I mean, because if you think about how exhausting it is to run a new program, and then that's assuming that it's going to potentially be really good. Now it's like, imagine running a new program, but like you think it's actually not helping people that much. And assuming that you're living in a world where there is counterfactual funding and you really believe in that. And I do really believe in that, where people funded our project and they could have instead funded our friends' projects, which also looked really exciting. So I'm living in this world where I have this burden of, I feel like we have to be constantly living up to running a program that's good enough for that money. And if that program is worse off, then like maybe instead of sacrificing a bunch to make the world better, I am sacrificing a bunch and then actively making the world worse because we're not spending this money well. We didn't want to run a program that didn't work. And I think that felt so natural to us that it was surprising to us that people would think differently.
Hi, listeners. This is Luisa Rodriguez, one of the hosts of the 80,000 Hours podcast. At 80,000 Hours, we often encourage people to make bold career moves in pursuit of greater impact, whether that's leaving a finance career to develop software for animal welfare organizations, stepping away from a PhD to work on AI safety, or launching a global health charity. We encourage people to make these choices, knowing there's no guarantee of success and that things not working out, not getting that job, for example, is painful and costly. We think that taking those leaps anyways, despite the risks, is a very brave thing to do. And in addition to celebrating the instances where people have taken those risks and gotten the high-impact job, we also want to celebrate people who take the risk but don't accomplish the thing they set out to do. Those people, too, have been brave and ambitious in their pursuit of impact. In today's episode, we are celebrating an ambitious attempt to have a big impact that didn't work out. I'm joined by Sarah Eustis-Guthrie, who co-founded the global health charity Maternal Health Initiative. The organization aimed to deliver postpartum family planning services in Ghana, but after Sarah and her co-founder ran several pilots that showed the intervention wasn't working as well as they hoped, they decided to shut down. We talked through the full story with all its ups and downs, including the evidence that made Sarah and her co-founder Ben think their organization could be impactful and cost-effective, both from a health perspective and from an autonomy and well-being perspective. Early yellow and red flags that suggested they didn't quite have the full story about the effectiveness of the intervention. All the steps Sarah and Ben took to build the organization and where things went wrong in retrospect. Dealing with the emotional side of putting so much time and effort into a project that ultimately failed. Why it's so important to talk openly about ambitious projects that don't work out, and Sarah's key lessons learned from the experience. Sarah is amazingly candid and thoughtful about all of this. I got so much out of the conversation, and I think anyone who struggles with these kinds of challenges around having an impactful career will too. Okay, without further ado, I bring you Sarah Eustis-Guthrie. Today, I'm speaking with Sarah Eustis-Guthrie, one of the co-founders of Maternal Health Initiative, a nonprofit incubated through charity Entrepreneurship. Thanks for coming on the podcast, Sarah.
Thanks so much for having me. I'm thrilled to be here.
So you and your co-founder, Ben Williamson, made the incredibly brave decision to found a charity, and then you made the decision to shut it down, which I think for me would probably have taken even more courage. So we're going to talk about the full story today, including a bunch of lessons you learned and just what the kind of experience of that was like. But before we dive in, just at the high level, why do you think it's important to share this experience?
We live in a really messy, complex world, and it is hard to get things right. And when you're trying to make things better, often you're going to do your best and figure out, oh, wow, this didn't turn out the way that I hoped that it would. And when you get to those moments, I think you have this choice. You have this choice of we can kind of paper it over. We can be like, everything is fine. Or you can try and be upfront with everyone and say, hey, this thing didn't work out. If you're trying to make things better, maybe don't try this thing. And I think there's a lot of factors in human nature. I know it's certainly true in myself. I don't like talking about the times things didn't work out. But I also think that there's a lot of factors that are specific to development that make it hard for folks to be transparent about when things aren't working out. And I think that's a shame because there's so much that we can learn from these, I guess you could call them failures, maybe just times things didn't totally work out. There's so much we could learn. And so I think we were excited about the chance to talk about how things didn't work out for us in the hope that this could become more of a norm.
Yeah, I love it. Let's go ahead and dive in. So you and your co-founder, Ben, who I believe you met through charity Entrepreneurship, explored a bunch of different potentially cost-effective interventions together over probably something like a month or more. And you eventually settled on postpartum family planning as an intervention you wanted to implement through a new charity. And just to make sure we're on the same page, postpartum family planning is basically an intervention that involves kind of integrating counseling about birth control into postnatal care and child immunization appointments to basically increase birth control uptake and therefore reduce short-spaced pregnancies, which are pregnancies that happen kind of one after another. And I guess short-spaced pregnancies come with higher chances of preterm births, low birth weights, and infant maternal mortality. So reducing short-spaced pregnancies seems good, especially if kind of getting pregnant very soon after having had a baby isn't even what the mother wants. What did you understand as the kind of basic case for postpartum family planning in particular when you looked at it as a way to address short-spaced pregnancies?
So we were really excited about postpartum family planning. That's why we ended up picking it, as you mentioned, over some other really exciting interventions. But we thought it had a really compelling case for not only having really great benefits for women's health, but also helping them have greater access to their own autonomy, greater ability to live the kinds of lives that they want to live. So let me talk about family planning first. Around the world, 1 in 10 women of reproductive age worldwide, so that's 218 million women, want to postpone or avert a pregnancy, but aren't using modern contraception. And so that's what's known as unmet need for family planning. And that's a big concern because having a kid, that's not a minor thing. It has a huge impact on people's lives. And people have a right to choose if they have kids, when they have kids, and access to family planning is a great way to make sure that women can live the kind of lives that they want to lead. So we think that there's great autonomy benefits there. But there's also health benefits, especially in low and middle income countries. So unfortunately, pregnancy and birth are dangerous for women and their kids in low and middle income countries. So there's about 300,000 deaths per year that are related to pregnancy, related to childbirth. And so if you give people access to family planning, that allows them to reduce these risks. So there's both the autonomy benefits and the health benefits. So there's been a lot of investment in family planning and a lot of different ways people try to make this happen. But one context that's really widely recommended is postpartum family planning. And what does that mean? So postpartum family planning means that you are giving women counseling and giving them access to contraceptives in the first year post-birth. So for the record, when people say postpartum, usually that means the first 6 weeks when they're just talking about that. But postpartum family planning, that's like the first year. So why is that an exciting time? So first of all, for a lot of women in low and middle income countries, unfortunately, they don't get to go to health facilities very often. It's expensive, maybe it's difficult to get to. But in recent years, there's a lot of coverage of women going to health facilities at some point around a birth. So maybe they're going right before birth, when they're doing delivery, for an immunization checkup. So it's a really exciting opportunity to meet women where they are. But the main reason for postpartum family planning is that it's actually riskier for women to give birth soon after a birth. So that's what's known as a short-spaced pregnancy. So typically, if a woman gets pregnant, the usual definition is She gets pregnant 2 years after she gave birth. But, all the different agencies like to kind of extend that. Oh, it's 3 years. Oh, it's whatever. And it's riskier for women if they have these short-spaced pregnancies. But actually, family planning usage is often way, way lower soon after a birth. And so that's a big concern. Women are at higher risk. They're using family planning less. And it's an opportunity when you can actually talk to them. So postpartum family planning is a pretty widely recommended intervention. It's known as a quote unquote proven high impact practice in family planning by folks like the WHO and Gates. And Charity Entrepreneurship looked at that. They ran some of the numbers and they said, hey, we think this is a really exciting intervention.
Yeah, so that all makes a lot of sense to me. But what exactly is the reason that having another baby soon after having, maybe a first one is dangerous?
Yeah, that's a great question. And you'll be excited to know that doctors are also wondering about this. So it's not totally known. Part of it is this idea of nutritional depletion. So one thing to flag is that it's a lot riskier to have short-spaced births in low and middle income countries than in higher income countries. And it tends to lead to worse health outcomes. And I think generally the idea is that if women are malnourished or maybe they're close to malnourished, it's really taxing on the body to be pregnant. You're supporting a developing fetus and then to give birth itself. And so the idea is that if a woman gives birth really soon after, her body doesn't have time to rebuild her stores of vitamins, even just calories. And so that it leads to a higher likelihood of things going wrong just because the body isn't as prepared. But this is an active area of research.
Okay, so that's the basic picture. How did you then decide kind of where to found this charity?
So that was what we spent the first 3 months of our time thinking about. It's a really important question. And the way that we thought about it is you want to find the place to work that's as cost effective as possible, but where it's also feasible to implement it. So what we did is we made this ginormous spreadsheet. You'll find everyone in the charity entrepreneurship sphere loves spreadsheets. And what we did is we put in data on a lot of countries in sub-Saharan Africa on issues of one, how cost effective would it be? So what that looks like is how high are rates of family planning? So all else considered, you want to go to an area where there's currently lower rates and there's room for them to get higher. You also want to look at areas that have relatively higher maternal and child mortality because that's driving the effects of the intervention. You also have to think a bit about cost. So is it going to be really expensive to implement in? And then you have to think about the feasibility side of things. So there's kind of this ongoing known fact that if you just say, really for any health intervention, hey, what country should I work in? It's often really likely that if you do a bit of a naive thing, you'll end up and it'll say, you should definitely work in Afghanistan or South Sudan, countries where it's really tough to work and unfortunately have tragically high levels of various mortalities. So you have to say, is it actually feasible to work here? Would the government want to work with me? That's especially sensitive with family planning. And so we did this massive spreadsheet, right? Then we ranked things. And what we ended up is 3 top countries. So the 3 top countries were Nigeria, Sierra Leone, and Ghana. And each of these countries had a different risk profile and kind of a different set of pros and cons. Nigeria was maybe the one that we were most excited about, but unfortunately, circumstance intervened, which is the fact that there was a federal election in Nigeria that was about to happen. And Nigeria has had some political instability. We really wanted to go visit that fall, and folks told us, look, it is just not safe for you to go to Nigeria right now. And there's a decent possibility that it still won't be safe 6 months after the election. And we looked at each other and we said, look, we can't run a program and not be able to visit. So we told ourselves, look, hey, if the program works somewhere else, we can scale to Nigeria's in the future.
Yep, nice.
And then the situation with Ghana and Sierra Leone was that Ghana is a relatively better off country, doing better economically. And that means that the cost effectiveness is potentially a bit lower. But it also means that it's more feasible to work in and potentially much more feasible to scale in. And what we were really excited about is not a program that works in one or two hospitals, but a program that can scale up to cover the entire country. And so Ghana, we think, had this really compelling case for we could potentially scale up, we could cover the entire country. But Sierra Leone, on the other hand, they're in a tough spot. They had a really brutal civil war about 25 years ago. And when you go there, it's just apparent how much they're struggling. So it has some of the lowest human development index in the world for a place that's not actively in civil conflict. You spend time even in the capital, and the electricity is really unreliable. The hospitals have trouble getting things like gloves and running water. So we had these questions about whether we should work in Ghana or Sierra Leone. And so what we ended up doing is, hey, we can't decide these questions through desk research. So we ended up going on trips to visit both countries, speaking to government implementation partners. And we ended up deciding that Ghana made more sense, that we felt like we had better choices for implementation partners and a better chance of having a really great program in the medium term.
Okay, so you decided postpartum family planning in Ghana, maybe scaling up to other countries if it goes well. Did you have specific hopes for how cost-effective, kind of a successful charity implementing that intervention in Ghana might be?
Definitely. This was very important to us. What's the cost effectiveness analysis? What's that number? So we hoped that it could be cost competitive with some of the most effective global health charities. And if you want the technical side of it, what that looks like is we estimated a number of about $70 per DALY averted. So DALY means disability adjusted life year. Basically, the idea is that for every $70 that you feed into the program, you help someone have an additional year of healthy life. And so that's a really exciting number. I no longer endorse that number, but that was the number we had. But not just that, we also genuinely believed that there were real autonomy and also income benefits from the program. And so what we estimated is that it would cost $50 through the program to avert an unintended birth, which to me is a really exciting number when you think about how much that affects someone's life. And I think I just want to throw in here that there's a lot of people, myself included, who sometimes critique effective altruism by saying, hey, you often seem really focused on these interventions that are just about health. But health challenges are not the only challenges that people are facing. And so people are often excited about programs to improve rights or improve well-being. But what often ends up happening is that it's really hard to pin them down in an evidence sense, or how expensive are they? And so I think what made me really excited about family planning was that it's potentially this intervention where you can robustly improve people's lives in a way that's about more than just health.
Yeah. Oh, it's really compelling.
Oh, just you wait to hear how it didn't end up working out. But yeah, we were really excited about it.
Yeah. I mean, when I think about, when I try to actually wrap my head around $50 per kind of unintended birth.
Right.
I mean, I spend $50 on, I don't know, a dinner out with my husband each week, probably more often than that. And yeah, actually fully kind of grappling with there's a person who was going to have a baby that they didn't necessarily want to have. And that's all it costs to avert that birth. Yeah, is incredibly compelling. Okay, so after one kind of makes all of those decisions, what happens next? How do you go from deciding to found a charity in Ghana to actually implementing a working program?
Well, that's exactly the question I was asking myself 2 years ago. It was pretty daunting to be in this space of, hey, I now got a bunch of money and I now, get to start this organization, also have to start this organization. I think one thing I loved about my co-founder, Ben, is he's just one of the most entrepreneurial people I've ever met.
Wow.
And so when he was faced with that question, he was like, cool, we'll figure it out. All we have to do is just kind of ask people who've done it before, kind of think on a big picture way. Yeah, what do you have to do? And we'll just go from there. And meanwhile, I'm sitting there being like, how did I get into this situation? This is terrifying.
Yeah.
But we figured it out. And I do think he was genuinely right that a lot of it is kind of more simple than you might think it is. So if you just sit down and think, well, how would you start a health organization? Well, you think, well, I'm going to have to get permissions from the government. I'm going to have to figure out where I want to work. There's a lot of really concrete questions there. And so what we did is we reached out to a bunch of potential partners. These are local nonprofits that had implemented similar programs in the past. And once we had these partners, what we were tasked with is figuring out exactly what the program should actually look like. Because going from we want to run postpartum family planning to building an actual program has a lot of questions there.
Yeah.
And so when you look at the studies also, you'll find that postpartum family planning can look like infinitely different iterations. And one thing that we realized is that because we wanted to devise our programming based on the evidence base, based on the studies. And what we found is that studies tend to be very good at telling you the numbers about how the program did or did not work out, but they often don't have a lot of details in terms of what was actually in the program. So we found that we were lucky if it would say things like, the providers were trained for 1 day versus 1 month, and then extremely lucky if they would say anything about what the providers were even trained in. And so this process involved a lot of desk research. It involved a lot of talking to experts. So we would email someone and say, hey, we're implementing this program. Can you talk to us and tell us what exactly it was that you did? And I found myself feeling quite insecure throughout this process. I had this perennial fear that I would email people and they would say, who are you to found this program? You don't know what you're talking about.
Totally. Yeah, I would feel the same way.
Yeah, it got a bit better as time went on. I do think this was something that we struggled with and maybe was a bit of a mistake that we kind of perennially felt so insecure that it made us afraid to ask silly questions. Because charity entrepreneurship has this model that not everyone agrees with, which is that it gets people who are often generalist. Sometimes they get folks who have years of experience in a particular health program, but often it's people who are generalists. Maybe they're on the younger side. And charity entrepreneurship makes the case. And I believe it now even more than I did back then, because to be honest, I was a little skeptical. But they make the case that what you need is you need folks who are competent, who are willing to listen to experts, and will really make programming that's based on those experts, but you need people who are, willing to make tough calls, willing to maybe relocate across the world. And that in general, it can be hard to find people who are both an expert in some particular program and who are willing to uproot their lives and do this really risky, uncertain endeavor. And so I totally endorse this model. But also, I think it's tough to be in that position of saying, hey, I'm on the younger side. Hey, I don't have prior experience in this. And meanwhile, you're across the table from someone who has 30 years of experience and a medical degree, and you're telling them that you want them to do things differently. So that could be a bit of an anxious part of the process.
Totally. Oh, yeah. I actually just hadn't thought of that. And I think that would be paralyzing for me. So at this point, were you having hesitations about the program?
We were starting to have some hesitations. So we initially founded in the end of summer of 2022. We were super excited. We got a lot of funding. Everything seemed to be going well. But then that fall, as we started digging into things further, there started to be some things that were concerning, and in fact, quite concerning. And one challenge for us is for things that seemed like maybe yellow flags, maybe red flags. It was hard to know how seriously to take them because we were in this situation where we were now founding a charity in an area that neither of us were experts in. And there was so much new information. And sometimes there would be something that seemed like a big problem. And then I'd talk to someone and realize, oh, that's not a problem at all. And then there would be something that seemed like a big problem, but other people maybe didn't totally agree. And it was kind of a gray area. I would say the first thing that was a red flag for us was related to our favorite part, of course, the cost effectiveness analysis, our big spreadsheet where we were figuring out how effective the program was. And what we found is that because charity entrepreneurship is the one who originally made the cost-effective analysis when they were deciding whether to support the program. And charity entrepreneurship really pushes for doing research that's as quick and actionable as possible. So they say, look, there's a real trade-off. If you take forever to do the research, then it makes things happen in the world slower. But they try to do research that's as good as it needs to be to make things happen. And I think that often works out really well. But I think we maybe started to enter some of the failure modes of this. And so we found that we didn't like the way that they were modeling basically the most important part of the cost effectiveness analysis, which is how you translate from increased contraceptive uptake to reduced pregnancies. Because if you think about this, in an ideal world, and this is going to become really important later, in an ideal world, the studies that are looking at how useful the program is would say, hey, this is how much they've reduced unintended pregnancies. But that's hard to measure, and it takes a lot of women. So a lot of these studies, and most of the studies we were looking at, get around that by just saying, how does it affect the contraceptive uptake? And that's pretty reasonable. But once you start thinking about how do you convert that into the numbers of how many unintended pregnancies are reduced, it gets really challenging.
Okay, so just to make sure I get that point, it's easy to measure the impact of an intervention on the number of women who decide immediately after the intervention to start using birth control. That's a very straightforward thing to measure. It's much, much harder to get a sense of how many women then didn't get pregnant because there's a long lag between the intervention and the women actually getting pregnant or kind of knowingly, decisively not getting pregnant. Is that roughly right?
Yeah, so that's roughly the picture. So we realized that we were uncertain in how to exactly model the translation from increasing contraceptive uptake to reducing pregnancies. But we decided that we were decently confident that the program could be relatively useful and that we'd wait and circle back to get the modeling exactly right later on.
Okay, so that was one, I guess it sounds like, yellow flag, something that you thought might end up making a difference to the cost effectiveness, but that was pretty hard to reason about, especially before you'd gone a bit deeper. Were there other yellow or red flags worth talking about here?
Yeah. So one interesting kind of funny thing that happened is we ended up going on a trip to Ghana even before we decided on it as a country, because there was another family planning charity that was going on a trip. This was actually only a couple weeks after the charity entrepreneurship program had ended. But they said, hey, we're going to Ghana. We know you're considering it. Do you want to just kind of tag along? And so we thought, hey, let's tag along. So we went on this trip. We went to some hospitals. We spoke to some experts. And we both got kind of a bad gut feeling from the trip, if that makes any sense. It's a bit hard to pin down, but I think some of it is we were struck by how high the baseline level of family planning access was. And to be clear, we were mostly in the capital, Accra, so that's going to be very different from other regions of the country. But you're just walking around, you see a billboard for family planning, or I did this thing where I went into a bunch of different pharmacies and I asked if I could get family planning, which was a slightly awkward experience, but really interesting. So that was in September. And then as we worked on the geographic analysis, we realized, hey, there's actually really strong fundamental reasons to do it. And also, as people who are evidence-based, we don't want to over-update on gut feelings. And honestly, even now, I don't really know what to do with this. I think we actually made a pretty reasonable call in still going with it, because one thing we found later, and you can see has a kind of obvious truth, is that there's so much variation within countries. So later on, when we'd go to more rural regions, it's like you're in a totally different country in terms of the access. And our program was predicated on, we were mainly working on in the northern parts of the country where the situation is totally different. But still, in retrospect, it does make me feel a little silly to say, hey, we had this bad gut feeling. And then in some senses, that bad gut feeling panned out. And in fact, and I'm almost a little embarrassed to say this, but what ended up happening is that we had so many doubts, the ones I mentioned, but also a number of other ones, that we sat down in that fall and we said, is this still a good idea? Should we still do this project? And I think we felt a lot of feelings about this because people had been so excited about it. We'd been so excited about it, but we were starting to say, are we kind of in over our head? Is this less promising than we thought? And so we sat down and we did some desk research. We talked to some experts, and ultimately we said, We think that there's still a decent chance that this is a phenomenal opportunity. And we think that we just can't resolve these uncertainties until we actually run a program on the ground. So let's go run a program on the ground. And in a year, we'll circle back and we'll say, were we right about these uncertainties? And we thought that there was a decent chance that we would say, we were totally wrong, and this is actually phenomenal. And then some chance maybe we'll look back and say, we're fools, we should have shut down back then. And some chance we'll be somewhere in the middle. And so we ended up saying, we have these concerns, but we're going to set them aside. We're really going to commit to running this program.
Yeah. I mean, from where I'm sitting and from what you said, that to me sounds like a very reasonable way to reason about this. And I will ask you more about kind of how you look at that decision after the fact. I'm sure it'll be tempting to be like, we were fools, but I'm not sure that you should be concluding that. Okay, so before we get to, those on the ground tests, any other yellow flags, worth mentioning?
So one other thing that came up is this factor of postpartum abstinence. And this is something that I'm going to talk about a lot later. But one thing that just popped up when I was literally just reading through various data on pregnancies and birth in sub-Saharan Africa was that there is a very common norm of postpartum abstinence where a couple doesn't have sex for a period following a birth. And in sub-Saharan Africa, the average duration of postpartum abstinence is 9 months.
It's pretty long.
It's pretty long. And I read that and I was like, wait a minute. Okay, I'm not a total expert yet, but if you're not having sex, I'm pretty sure you can't get pregnant, right? And it seemed like potentially a big problem just on a very basic a priori way of looking at this. And so the concern here, and I do think that we'll talk about this a lot more later as we dig into this, is basically that maybe if you have a program that's all about increasing women's contraceptive uptake, maybe you're increasing that uptake among, in part, women who are currently abstinent. And so that isn't that useful, right? And so you can have a program that looks really useful, like, hey, we increased uptake for women at 9 months post-birth, but maybe half those women are abstinent. And so like the impact on pregnancies is half of what you would expect, something like that. But there was very little discussion of it in the literature. And so what we did is we talked to a couple experts about it. And we said, hey, is this a concern? And when in those conversations, I remember thinking, I couldn't tell if it was a really dumb question to ask or a really important question to ask. Because I'm sitting there thinking, why aren't people talking about this more? This seems really important. And the experts were not that concerned. They were like, it's not a big factor. That's only for some women. And I mean, it is important to point out. So that is a mean. So what that means is that half of women aren't abstinent. And it is true that, this whole thing is because of short-spaced pregnancies. And so short-spaced pregnancies are happening. Like, we're confident in that. And so in that sense, it's not that big of a factor in that the pregnancies are still happening, right?
Yeah.
But still, this was one of the biggest red flags where in the months to come, I would sometimes just have this thought of, what about postpartum abstinence? We never really figured that thing out. But we kind of decided to set it aside, mainly because we were deferring to experts. And I'm not even sure. Yeah, I think it's hard to say when you're in that position. There's so many things where we didn't have this background and we had to decide on any given decision, how much do we defer to experts? And we tried to err on the side of deferring more in the very beginning. And I think that's kind of a reasonable call, just in the sense that there was so much we didn't know. But sometimes it did lead to these situations where we're sitting there thinking, this seems like a problem. And the experts don't think it's a big problem. And it's hard to know how to square those two perspectives.
Yeah. And I am sure you have this feeling of like, I'm a generalist.
Right.
Maybe this is my first trip to Ghana and I'm learning about family planning in this like in-depth way for the first time ever. And experts are telling me this is a non-issue. So is it the case that like, despite being a generalist who's very new to these topics, I'm somehow getting something that the experts are missing? Like, that feels like a very...
What's more likely? That I've made this radical discovery that the experts haven't figured out, or that I'm just making a silly mistake. Because there were a lot of times when I just made silly mistakes.
Right. Okay, so that sounds like a very significant yellow flag, but also one that I would also not know what to do with, given that people were telling me not to worry about it. Okay, so let's get to you basically planned 2 proof of concept tests and a pilot in Ghana, hoping to resolve a bunch of these uncertainties and I think just narrow down on like exactly which version of this thing is going to work. Can you talk through what these are and kind of why you did them, I guess starting with the proof of concept tests?
Right. So in the first year of a program, we thought about it like we were trying to resolve 2 uncertainties. One of them is we wanted to develop the best possible program that we could. And the other one was that we wanted to figure out whether that program actually worked. So when we were trying to figure out what kind of programming we wanted to run in the first year, we wanted to design a plan of programs that would both allow us to iterate a bit to try and figure out how can we make this program as good as possible, while also giving us the opportunity to robustly test and to get some evidence on how well the program worked. And so what we wanted to do was to run programming in the field as quickly as possible, because we had the sense that, we'd done a ton of desk research. And at this point, the uncertainties were about what it really looks like in the field. And I think the other motivation for the proof of concepts was being realistic about this fact that we were learning how to do this as we went along. And we anticipated that we would make a bunch of mistakes. And we didn't want to end up in a situation where we were just running a pilot to start with, where we were doing all of our evidence generation. And then you're 2 weeks in and you realize, oh no, I've made this terrible, obvious mistake. And now all of this evidence is useless.
Totally. Yeah. Did you feel like you learned a bunch? Did it feel like you, I don't know, ruled some things out, made huge mistakes, changed the thing?
All of the above. I mean, I would say I would characterize charity founding as this experience of like building the plane while flying the plane, while learning how to fly a plane at the same time. And so for me, at least, that was simultaneously stressful and thrilling. I was learning so much, and it felt so meaningful to be doing this work in the real world that was hopefully going to be really impactful. But it was also pretty stressful because you're sitting there and suddenly your decisions aren't just, affecting you or your coworkers, but your decisions, maybe if you mess something up, someone is going to give incorrect information, healthcare information to a client, right?
Yeah.
So I would be sitting there designing the training for the healthcare providers and thinking, who am I to be doing this? And I dealt with a lot of those concerns by building in checks. So it's like we would have doctors review our materials, all that jazz. But it definitely was a little bit stressful. Okay, very stressful.
Yep.
So our first proof of concept project, we were trying to figure out a bunch of big questions. So what kind of programming did we want to run? And then where did we want to run it? So in any country, there's going to be a variety of types of health facilities. So in Ghana in particular, there are more community-focused facilities where you have one in most towns or rural areas. You have these health clinics that are kind of in between, and then you have hospitals where you have a lot of folks going in. And so for our first proof of concept, we actually worked at 2 of each type of facility because we wanted to get a sense of what it was like to work at these different facilities. And then we also just wanted to figure out, what do we want to train healthcare providers in and how is it going to turn out? So our first proof of concept was pretty modest. We developed a 1-day training for healthcare providers. And this was healthcare providers that work both before a birth, during a birth, and after a birth. So before a birth, that's what's known as antenatal care, and then around labor and delivery, and then post-birth. And so in Ghana, post-birth includes both this first 6 weeks post-birth. That's the immediate postnatal care where a woman's going to go. She's going to get a checkup from a nurse. Maybe a doctor will come in if there's some concerns. And that usually happens at 2 weeks following a birth and then 6 weeks following a birth. And then in that longer postpartum period, they have these immunization clinics. And these immunization clinics, in many ways, are a real success story because in Ghana, they've managed to get it where even women who are very rural, quite poor, nearly all women will come in to an immunization session at some point. And I think there's a real belief in, hey, this vaccine is going to help my baby. And so we were excited about those immunization sessions as a time to give that counseling because that counseling could potentially reach, even the poorest women, even women in these really rural areas. So in that first proof of concept, we ran this training. We got a local expert, a nurse who also worked with the government a bunch to run this training. And we were working with women, with nurses from all these different touch points. And I would say it went well. I mean, we did not focus a lot on evidence generation. We did not focus at all on evidence generation. This was mainly, can we run a training? Do people seem to find it helpful? And I think it was generally true that, yeah, we were able to run the training. It did seem generally helpful.
Okay, that went pretty well.
Yeah, that went pretty well. And so after that first proof of concept, we said, hey, we want to start making decisive decisions about what the program's going to look like. And we want to run a much bigger proof of concept. We called it our mini pilot that would basically look the same as the pilot in terms of what kind of care was actually being delivered, but where we wouldn't focus a lot on evidence generation. Because one thing to just flag here is that if you're trying to generate a lot of evidence about a program, especially a small program, that evidence generation can actually be just as expensive or more expensive than running the program itself, which I don't think I had fully processed before this. But if you want to do surveying where you're surveying enough women to get a big sample size, you might have to have surveyors in the field for weeks on end. You know, you have to develop these surveys and have them deploy it. Versus if you're doing a relatively light touch intervention, that might just be a one-day training. So that was a learning for me. And I think actually maybe speaks to why people sometimes don't do a lot of evidence generation. And so we made a couple decisions. So one decision that we made is that we wanted to focus on hospitals rather than any other touch point. And we basically made that decision because they reach many more women per day. And so it's easier to get to a cost-effective program just because the reach is a lot higher. The trade-off there is that they tend to be busier, maybe they have less time per person. And I think this actually reflects a lot of the choices that we made throughout the program. We were really focused on how can we make something that's cost-effective and scalable. And we knew that there was some chance that it would be so light touch that it wouldn't actually make the changes happen at all.
Yeah.
But for us, because the program was only worth doing if it was cost-effective and scalable, I think that led to a different set of incentives than someone who's just running a study and trying to make things happen at all costs. So we were struggling a lot with this question of what specific touch point should we focus on in terms of when are women getting counseled, because we found that there was really substantial trade-offs at play here. And so we had a sense that at that immediate postnatal care, that was the best chance to have really in-depth conversations with women, because these tend to be one-on-one appointments. Maybe a woman has 20 minutes, 40 minutes to sit there with a nurse to really talk through the concerns. And when it comes to family planning, confidentiality is really important and really helpful because there can be a lot of social pressures. I remember talking to one expert who said something like, in some contexts, you don't want your neighbors to be, walking by and saying, oh, yeah, that's the woman who's using family planning. And, what does that mean? And of course, there's a lot of variation in the social pressures. But we were very cognizant of wanting women to have a chance where they could really go in depth to talk about their concerns. And I think this points to something larger that's important to flag, that when it comes to family planning use, experts hypothesize that some amount of women in low and middle income countries, some amount of them using contraceptives less is about not having access to start with, where if they wanted something, it might not be able to get at the local pharmacy. It might be tough for them to get it. But another chunk of the lack of use or lower use comes from people having misconceptions or misgivings. Mm-hmm. So maybe they've heard rumors in the local community that if you use a certain type of family planning, that it'll make you infertile or that it'll cause you to gain a lot of weight or that sort of thing. And so a lot of family planning programs, including our own, have a component where they're trying to make sure that they can address women's misgivings. And we were really excited about this one-on-one opportunity as a way to address those misgivings. But of course, as always, there are trade-offs. And the trade-off here is both that there's lower reach with that immediate postnatal care, because not everyone delivers in a facility. Some women are just coming back for those immunizations. And also, it's more of a lift to get providers to add in this in-depth conversation. So if you're thinking about a busy hospital where there's a lot going on and providers have a lot of priorities, getting them to have this longer conversation, they might not be fully bought into that. And so we were concerned, are we going to be able to make this happen? Will providers actually do it? And so we were comparing the postnatal care to those immunization sessions because the immunization sessions offered the chance of a lot of reach. A huge chunk of women come, and many of them might come back either every month in the first year post-birth or just throughout the vaccination schedule. So there's a couple different shots that kids get, and women are often pretty good at coming back for those shots. And so we were excited about the high reach, but we were even more concerned about actually making it happen at these immunization sessions, because if you go, and we went to them, they're incredibly busy. You know, imagine you're in this outdoor pavilion, because a lot of these clinics, it's not even fully indoors, it's an outdoor pavilion. There's tiny babies screaming, there's women talking, maybe they're trying to weigh the baby and also give the baby a shot, and the baby is not happy about this.
Totally.
So there's a lot going on, and there's a lot of pressures. So we were worried about, can we actually make this happen? And also, can we have as high quality of an encounter? You know, if you're sitting there with the squalling baby getting the shot and all of your neighbors are nearby, do you really have the opportunity to have this in-depth conversation where you can say, hey, I have these real concerns, and the provider can respond to them? So we ended up kind of cheating in response to being uncertain, which is we said, let's try both. And we sort of similarly to earlier on with our trip and visiting both countries, we said, look, we have these fundamental uncertainties, and we think the best way to resolve these uncertainties is actually to try both options and to get some real world data on how they work out. And also because we were really freaked out by the idea of running one program and it not working out at all. So we thought, hey, if we run two, then it has a higher likelihood of working out. So we ended up deciding for both the mini pilot and the pilot, we do both of these arms. So one of them at the immediate postnatal care and one of them at the immunization sessions.
Great. Did it seem like things were going well? Did you have any yellow flags at that point?
Definitely. I think we felt kind of mixed as things were going. So one thing we found is that our providers and our local partners loved to tell us how well things were going. And they would say, oh, things are going great. You know, we've hugely increased the family planning uptake in this one location. And we, of course, had some amount of skepticism of this because we understood how strong the incentives are. And I think real pressures, including both cultural pressures and financial pressures, for providers to feel like it's frankly rude to say, we have these concerns about this program. And so this was one of the big challenges for us, is that what we wanted more than anything was the providers to tell us, hey, we have this concern about the program. We think maybe if you change this thing, it could go better. But they're there. And I mean, I don't know exactly what they were thinking, but I think they were thinking something along the lines of, it would be rude to say things aren't going as well. It would be like I'm criticizing their sense of authority. Also, like, they're paying me. There's these financial incentives. If they think the program's going really well, then they're more likely to scale it. And so what happened is we ended up continually saying, please, please, please tell us when things aren't working out. And we'd ask questions framed to say, okay, what was one thing that went well this week? What was one thing that went poorly this week? And we did get some genuine, useful information that way. But it was a consistent challenge. So we had some folks on our local partner team who were quite frank. And some of the issues that they were raising was feeling like the providers weren't totally convinced of the value of adding in this additional counseling, partly because even if you imagine a scenario in which the program is wildly successful, what it still involves is providers have a lot of conversations with women in which women are not at all convinced and don't change their behavior at all. And sometimes some fraction of the women do change their behavior. But what this experience often is for the provider on the ground is 5 times out of 6, nothing happens and they get this resistance. And we actually got like quite interesting through word of mouth, like words from women about this, where, for example, at the immunization sessions, they would say like, look, I need to get home so I can work so that I can feed my family. Why are you making me listen to this spiel? And I think that gives a sense of both sort of how some women were thinking of it, but also I think is an important reminder that the costs of running these programs aren't just the costs of what else could you spend the money on, but programs like these impose genuine costs on both providers and just the women who are involved. And so I think that's a call to be really thoughtful about when you're taking up people's times. Because yeah, when I would hear that sort of thing, I would not feel great.
Yep. It's also, yeah, I don't like the fact that hadn't occurred to me as a cost of the program. I don't think it's very common for people to be like, I'm going to deliver this intervention, but I should think really hard about whether it's worth the beneficiary's time.
Right, absolutely. And I think this is something that has come up as we've talked to other people about the programs, people who are more bought into the programs, who have this attitude of, well, it seems vaguely useful, why not do it? And I think one question is, how do you fully account for the costs? What are these costs? And I think when you're working in a resource-limited context, you have to be particularly sensitive to this because some of the other stuff that they're doing is quite important for health. So like you don't want to take time away from giving vital immunizations in order to do family planning. Like the ideal is that you do both, but you don't always live in that ideal world. And so every week I would be exchanging messages on WhatsApp with these nurses. And as I said before, they'd often be quite positive, but it was also just really interesting to get this ongoing feedback where, for example, they might message me and said, well, I told, 8 women this week about family planning, and I was very sure to talk about all of the benefits, but most of the women told me that they didn't need it because they were still breastfeeding or they were still living away from their husband. But, next week I'll be even more persuasive and it'll be different.
Wow.
But I do think there's an easy failure mode where you're very divorced from what's happening on the ground. And by having these ongoing communications, it definitely changed my perception of how things were going, just to kind of get this communication directly from the source of this is what's going well and this is what's not going well. So that was quite interesting.
Yep. Okay. And was that enough to make you worried?
I mean, I was definitely worried. I think it's always this balance where you have to say, hey, we're getting this qualitative feedback, but you can easily imagine, I think it's true of a lot of programs. There's a lot of programs where people give qualitative feedback and maybe they're grumpy about it. Maybe there's a big vaccine push and someone says, oh, I don't want to take the time to get this vaccine. But then you look and it's reduced mortality by 5%. And at the end of the day, like, the complaints are useful insofar as they point to wider truths, but we wanted to really wait for the data to get that sense of those wider truths. So I think genuinely during the program, it was somewhat mixed. We had some positive signals, including some genuine positive signals and not just fake positive signals, always difficult to distinguish. We had some genuine positive signals. We had some signals that were concerning, but we were saying, look, we're going to reserve judgment until we get more of these results and see how things turn out.
So then you wanted to actually do the version of the pilot where you kind of roll out the program as you intend it and actually measure your results. What was the rough setup?
Yeah, so we did a pretty straightforward pre-post study where what we did is we surveyed a bunch of women, about 200 women at the facilities, but before we'd actually rolled out the program. And then we asked them a bunch of questions about their knowledge, their attitudes towards contraception, and then also their actual contraceptive use and their intended contraceptive use. So we asked them all these questions, and then we rolled out the program, and then we got a different set of women who were hopefully being exposed to the program, at least in theory, being exposed to the program. And we asked them those exact same questions about their knowledge, their attitudes, and their contraceptive uptake.
And so did you have a number in mind when waiting for that evidence to come in? You're like, okay, we've got these positive and negative signals, but we're going to wait for the evidence. And we need the evidence to say, that some percentage of women changed their contraception plans. Did you have a sense of where that threshold for yes, this is good enough was?
Yeah, absolutely. We thought about this a lot and we settled on, we hoped that the program would increase contraceptive uptake by about 10%. And if it did it more than that, we'd be enthused. If it did it somewhat less than that, there was maybe room for, hey, we can improve the program. But that 10% was the target that we were really hoping for.
Okay, so yeah, my sense is that at the point where you start getting the kind of results from the pilot is the point where things started clearly looking disappointing. Yeah, can you talk through what those results look like?
Definitely. So we ended up with two sets of results. So we had the results for the immediate postnatal care and then the results for the immunization session. And the results for the immunization session looked pretty clearly not good. So we found both that while implementation was happening on the day that we did the surveying, so the surveyors show up, the riders are like, cool, now we got to do the thing. And they would give the group talks. They would do this one-on-one counseling to women about family planning. The implementation was happening that day, so we felt like we could trust the results on how much it changed people's behaviors. But we felt decently confident that it wasn't reliably happening on other days. So implementation for immunizations, that's a bummer. And then in terms of the results themselves, it showed no statistically significant effects on either people's actual contraceptive uptake or what they said that their plans for the future would be. So not great.
Yep.
And then on the postnatal care arm, things looked not great, but a lot more complicated. So what happened is when we asked women on that day of the surveying, so we would survey them right as they were leaving facilities. And when we asked them about their contraceptive uptake, about their intended uptake, we found that there was no difference between the women who hadn't been exposed to the program and the women who were exposed to the program. But one thing that we also did is that we called women up 2 weeks after the program, and we asked them then about their uptake. And the reason we did this is because when we talked to folks on the ground, we learned that, especially in the context where we were working, women often consult with their partner to varying extents before they take up a method. So maybe they're there and they get intrigued by family planning, but they say, oh, I have to go ask my husband's permission. They go ask their husband's permission. And so we wanted to make sure we were capturing that. And so what we found is that the data from that phone survey did show an increase in contraceptive uptake, and actually a decently large increase, about 20%. But the problem is that that data is much lower quality because about only half of women picked up the phone, and we're worried that the women who picked up the phone were a very different sample. And we also had implementation challenges with this arm. So what happened is we were doing postnatal care in 3 hospitals. And in one of the hospitals, it seemed to work really well. Like it was happening the day we were there, but we're also pretty confident it was happening most of the time at other times. And then at 2 of the hospitals, it basically wasn't happening. And it even wasn't happening very well on the days that they were surveying, which, is a bummer.
Yep.
But again, this is where it gets complex, because when we looked at the data from just the hospital where it was actually being implemented, there was a real increase in contraceptive uptake, and one that was even larger than 10%. But we didn't power it so that we'd be able to trust it on a facility by facility level, right? So what I can say to you here is, hey, there's suggestive results that shows that maybe this is working in this facility where it's happening, but I can't say with a lot of confidence that it's happening. So overall, we felt that those results from postnatal care were a disappointment because they showed that there were real challenges in implementation. There were real challenges despite us going to a lot of efforts to try and make sure that things happen. And then also the results on the effects were at the very least mixed.
How did this feel?
Not great. I remember it was around Thanksgiving, I think, and I was visiting my family, and I remember I was sitting and I was like parsing the results, because it's not like just like a number pops up. It's like you have to do some amount of analysis, and I was seeing these numbers, and I was just scrolling through the surveys, and I'd be like, not using, and I just felt terrible.
I mean, like gut-wrenching. It must have just felt, really awful.
I think part of it is that when you run an organization, you feel very personally responsible for what's happening with that organization. And I think this felt extra strong for us because not only had we decided to found this organization, but we decided to found this organization as opposed to other organizations that could have been really, really good. And so like that was my co-founder and I kind of like staking our claim for like, we think that this is good. We think that this is so good that we want you to give money that you otherwise could give to these other really compelling organizations. And then not only that, but, you know, I'm good friends with a lot of other folks in the charity entrepreneurship community, which is great. They're an awesome group of people. But what that means is that sometimes I'll be chatting with someone and like in the nicest possible way, it's like their program's going phenomenally. They're helping so many people. They're getting this huge grant. And even though I think people make an effort to make it non-stressful and like non-competitive, it's such a warm community. It also just is inherently, you're sitting there and you're thinking, man, is it the intervention or is it me? And it's yeah, not the best feeling ever.
Yeah. So were the results, just to give me a sense, were they like, I don't know, maybe this is still plausible, or were they like, this is not changeable into a version of the program that's worth running?
So that's a really important question. And that's a question that we did not immediately know the answer to. I think especially with those postnatal care results being so complex and nuanced. Like initially I saw the results and I said, man, this is all terrible. It's pointless. None of it worked out. And then I started digging into the facility by facility level things. And then I said, oh, this is exciting. Maybe actually it's fine. But then I realized, oh, there are these concerns about it. So those next 2 months, there was this real sense of seesawing back and forth on how promising is this. And I will flag that, like, I don't think you should expect that every pilot for a great program will go well. So there's so much that's random, that's contingent. So we picked these facilities, maybe through random chance, some of these facilities, you know, were less likely to be successful. And I think you can look at a ton of programs that have had less successful initial pilots that turned out to be really good. And so I think if it had just been the numbers weren't as good as we wanted, but like we really believed that structurally it was a really phenomenal program, there would have been a ton of space to say, hey, can we make changes to just make the program look better? But I think what ended up happening for us was that we took those less promising pilot results, because at the very least, I would say they were somewhat disappointing. They weren't as good as we'd hoped. And we took that as an opportunity, an invitation to sit down and look harder at some of these questions that we'd worried about last fall, that had been the kind of thing that I thought about when I couldn't fall asleep in the middle of the night, and now we can finally dig into this.
Yeah, I mean, just on that, because I'm really interested in the experience of this. Yeah, I mean, are you being literal? Was this really keeping you up at night?
Sometimes, yeah. You know, I think my overall experience with charity entrepreneurship, with founding an org, was that the benefits were a lot bigger than I'd expected, and then the downsides were a lot bigger than I expected. And I think I would go back and do it again, and I would recommend other people do it. But also, I did not comprehend how big of a change in my life it would be. And I don't want to say that this happens for everyone, because I think people have very different experiences with it. But I think for me, that sense of responsibility, that sense of like feeling like the results really reflected on me, which I don't fully endorse as a take, and was something that I was trying to shift away from, but I found really tough, because it was just true that for some aspects of the program, how well they went were like a direct reflection of how good of a job I did. And sometimes I would make a mistake and that would have bad effects in the world. And that was really stressful. And then some aspects of the program had very little to do with how hard I was working or how smart I was about making a particular choice. And I think that I found that to be immensely stressful. And I found it hard to turn off thinking about the organization. I would try to do these things like, hey, I won't check Slack after I stop work for the day, and that kind of thing. But what I found is just I'd be walking around my life, and because this was like the most interesting and felt like the most important thing coming up in my life, that's what I would think about. So yeah, I did have this experience of I would wake up in the middle of the night to get a drink of water, and before I was even fully conscious, I would find that I was thinking about the organization, or I was thinking about some of these issues, and then it would be hard to fall back asleep. And I've talked to other people who say, yeah, I have that exact same experience.
Wow. Yeah, I'm trying to think of an analogy, and I'm finding it hard to, but it sounds closer to like, I don't know, having a child or something. Like you're like trying to like create this thing, and there's so much responsibility and personal ownership in a way that you just don't have in most cases when you are employed by a place to do a thing. And like the bottom line responsibility isn't with you.
Right. And I think there's a lot of jobs where people have that sense of real responsibility. And I do think that there are good aspects of this. Like I found it deeply satisfying and deeply fulfilling. I remember when I was thinking about applying to jobs before this, I was thinking, I want to have this feeling that if I work extra, if I'm working extra hard, that that'll make more good things happen in the world. I don't want to have this feeling of, oh, I'm accruing additional profit to a corporation, or, oh, it doesn't really matter that much how hard I work. But this is the flip side of that. This is the flip side where when it matters how good of a job you do, it's hard to let go of. And also, I do just think there is a big difference between being the person who's running the organization and then being someone who has a really substantial role, because ultimately so much of your job is making these really tough calls that you could potentially invest infinite time into. So it's really hard to know, when did I make a good decision? When did I invest the correct amount of time into making a decision? There's a lot that's really tough. And I think having a co-founder does make a big difference. There are some folks that solo found. I have so much respect for that. I could not have done that with MHI, but having a co-founder makes a big difference because you can really share that burden. And I also think having a community makes a big difference, where I would talk to other folks running orgs and say, oh my gosh, I found this thing immensely stressful and I don't know if I made the right call. And they would say, I felt the exact same way. And then also having advisors who we could turn to. And I think that helps take on some of that responsibility that's similar to having a manager. But I didn't totally trust that our advisors would be telling us in the frankest possible way if we were totally messing up. And so it was hard. I felt like I had to carry that burden myself. And so I ended up doing a lot of second guessing myself, a lot of asking myself, am I messing up? Am I doing a good job? And in retrospect, I wish I'd done more to try and offload that. But I think it's fundamentally just a super, super tough challenge.
Yeah, it sounds brutal. Okay, so you've got these results, and then you decide to spend some more time thinking about these questions that you're unsure about before. What exactly did that look like?
Yeah, so we had these pilot results. We took a bit of time to just do the direct interpretation of what are these pilot results telling us. So that took a couple weeks. And then we sat down and we said, okay, we have some serious concerns. We have some serious reservations. We want to circle back to all of these red flags, yellow flags from earlier on. And so what we did is we devised this research and reflection process. We made a ginormous Google Doc, and we had this elaborate plan. And then we got 1 week into the plan and said, this plan is too elaborate. We're going to make it less elaborate. But we had two main questions, I'd say. So one of them was, do we still think that postpartum family planning has the potential to be a really cost-effective, exciting opportunity? That's question one. And that's a question that has a lot to do with research questions, with digging into literature, talking to more experts. And then we had a separate question, which is, what are we going to do with MHI? And so maybe if we think postpartum is still great, maybe we'll keep running postpartum. Maybe we will pivot to something else, or maybe we'll shut down the organization. And in retrospect, it probably would have been ideal to fully resolve the postpartum question and then move on to the second question. What ended up happening was we did some work on it. We felt like we'd resolved it. And then I started having second doubts and going back into it again and looking into it again. So we basically kind of parallel processed these two investigations. But what we wanted to make sure is that we were both doing the research and looking into the kind of science questions, and that we were doing the reflection to say, like, are we still bought into this? Because we could imagine a world where we said postpartum seems useful, but we don't feel like we want to run this organization anymore. And we wanted to make sure that we were fully bought in, because I think that you can only do a good job if you are fully bought in.
Totally. Yeah. Okay, so you've got these two questions. You're working on them in parallel. What were you turning up?
So let's start with the scientific question, this question about how cost-effective postpartum is. So we talked a bit earlier about this question of how do programs that increase uptake, how does that translate into reduced unintended pregnancies? And back when we'd started, we weren't aware of any programs that had actually measured changes to pregnancy rate. But we said, let's check again. Let's do a dive. Let's see if there's any studies. And what we ended up finding is that there were 3 studies that actually looked into this, and that 2 of them found no changes to pregnancy rate, and one of them found only a very small change.
Oh my God.
So this was so fascinating to find. And it was just surprising because I think my assumption was if these studies existed, a lot of people would be talking about them. There would be discussion about them. But what we found is that A, these studies existed. B, there wasn't a lot of discussion about them. And C, even within the studies themselves, there wasn't a lot of discussion about them, or the discussion that was about them was never in the direction of maybe this program is less useful. The discussion was always like, maybe if we do this program slightly differently, it'll work better. Or just like, yeah, this still seems great. Please continue. And so that was a quite surprising finding for us.
Yeah. I mean, is there a way to square that? Like at that, yeah, I can't tell a story where like it improves contraceptive take-up, but it doesn't decrease unintended pregnancy, and it's still good.
Right. Well, I think there's 2 aspects of what you were saying right there, which is aspect number 1 is that on priors, it's really surprising that you would have a program that would increase contraceptive uptake, but that wouldn't decrease pregnancies, because it's just kind of, you think it's obvious, right? That's what contraceptive uptake does. It makes it harder to get pregnant. And so that's a question that we dug into a lot. But then there's the second part of your question, which is maybe it seems obvious to you that if there was a program that wasn't that useful at decreasing pregnancies, like that doesn't seem like a very useful program. And that's what Ben and I believe, but that is not what basically everyone else in the space believes. And so we dug into that question a bit as well.
Okay. So yeah, I guess let's tease those apart then. So the first one is just like, did you feel like you were able to make sense of this disconnect between maybe successfully increasing contraceptive use, but not successfully decreasing pregnancy rates?
Yeah. So our hypothesis on this is that it comes back to another thing that we alluded to earlier, this question of postpartum abstinence, and then this related factor of postpartum breastfeeding. So if you look at a lot of these models, including our own model of how uptake translates to reduced pregnancies, they always kind of assume that the postpartum period is similar to any other period, where there's a reliable way that using contraception translates to reduced pregnancies. But we've come to believe that it's not accurate to model the postpartum period in the same way that you model other periods. And so what this comes down to is 2 factors. So we talked about postpartum abstinence. There's this cultural norm where a lot of women don't have sex soon after a birth. This might even entail that they move to their mother-in-law's house for a while.
Wow.
Yeah, quite unlikely that they're having sex. And there's some argument about this where a lot of people will say, I don't trust women's responses to surveys because there's desirability bias, that they say that they're not having sex, but maybe they're really having sex.
Okay.
So I think that's one of the reasons experts don't take it as seriously. But for us, actually, a much bigger factor than postpartum abstinence was this factor of postpartum amenorrhea. So long word, tough to spell. And what postpartum amenorrhea means is not having a period after you give birth. And this is usually due to breastfeeding. So especially in sub-Saharan Africa, very high rates of women breastfeed soon after giving birth. It's super common. And breastfeeding on its own is not considered to be a reliable form of contraception. And so the World Health Organization, they say breastfeeding on its own isn't reliable. What you have to do is what's known as LAM, the lactational amenorrhea method. So I'm warning you, this is going to get a little technical. But so they have this very narrow definition for LAM, where in order for breastfeeding to count as LAM, it has to be exclusive breastfeeding. So the baby can't get any food or water aside from their mother's milk. It has to be frequent. So like under their definition, every several hours, including like sleeping. So it's like you have to like fall asleep and then like wake up and feed the baby and then fall asleep again. The woman has to be amenorrheic, so her period hasn't returned yet. And it has to be in the first 6 months after birth. So as I say this, I'm flashing back to when I was writing the trainings for healthcare providers and you're trying to explain LAM and it's like immensely complicated and it's very annoying.
Yep, horrible.
And so LAM, the WHO recommends you should teach women how to do LAM precisely as LAM, because when you do it precisely as LAM, it has this really high effectiveness rate. So like 98.5% protection against pregnancy. And what happens in practice is that a lot of women are breastfeeding, but they're not doing LAM. So maybe when their brother gives the baby a bath, they give the baby a little bit of water. Like this is the kind of thing that people talk about. And so when the WHO or whomever is going around and surveying women, like that woman, it would be like, okay, you're breastfeeding, but you're not doing LAM. So they would say, okay, this woman is at, complete risk of getting pregnant. And this is what I had always heard. And like when we started MHI, we focused on like LAM as one of the methods. Oh, you have to make sure women know all the criteria. And I guess my assumption had been something like, if a woman is not doing LAM, yeah, she's totally vulnerable. But after having months of getting these WhatsApp messages from nurses saying, oh, well, she says that she's protected, I got kind of curious about this. I was wondering, like, maybe it's somewhat effective. Maybe it's kind of effective.
Yeah.
And so this to me is one of the most interesting parts, is that I found a bunch of studies that what they did is they looked at women who weren't doing LAM precisely. So maybe it was 12 months after she'd given birth, but they were still amenorrheic. So they didn't have a period, but they were still breastfeeding. And what they found is a number of studies found that it was still pretty effective at preventing pregnancy. So I'd say on average, like 94% effective at preventing pregnancy.
Oh my gosh, that's really high. That is actually much higher than I expected you to say.
Yeah, it's really high. Yeah. So that was higher than I expected to find. And when you say this to someone, or I've had many conversations where I was talking to someone in the space and they would say, that's not high enough. Like, we want women to be totally protected, and like, that's not high enough. We should just, it shouldn't count, And I was, yeah.
Sorry, I'm squinting. It's not high enough for like whatever the bar is for like full contraception, but it is high enough to massively impact the counterfactual.
Yeah, absolutely.
Yeah, of how many pregnancies you'd expect. Oh, how frustrating.
So I think there's several interesting parts of this. So I think one part of this is we were coming at this from both a pragmatic approach and from kind of systems approach. So one, I can tell you it's like from a pragmatic approach, it's hard to get women to do LAM precisely. And it involves a lot of work. And also, I don't think they totally want to. And so I think I've noticed this tendency in both papers that people publish and in these like overall official recommendations where they'll focus on the ideal. They'll say like, it would be ideal if all women had the most protective things. But then when you go on the ground, you find that women often don't actually want those methods. So like you might ask, why don't all women just use IUDs all the time? And it's like, there are reasons women don't like to use IUDs, and that's totally fair. And so to me, respecting women's choice means respecting that some women don't want to use an IUD. It means respecting that some women don't want to do full LAM. And it means making sure that those women have that full information. It doesn't mean that you're going to pressure them to use certain methods. And one thing that I'll just throw in here is I was kind of curious. So I was talking to a friend who's an OBGYN here in California. And I said, what do you say to postpartum women about their family planning options? And she said, well, I say to women, if you're breastfeeding and you don't have your period, it's pretty unlikely that you'll get pregnant, but there is a real chance. So if it's really important to you to not get pregnant, you should use another method. But if it's not really important to you, that has you pretty covered. And to me, I thought, yeah, that basically aligns with what I see in the literature, but it does not align with the official recommendations,
totally,
especially for low and middle income countries. And it is true that it's riskier to have a short space pregnancy in a low and middle income country, but that's because of all of these terrible structural inequalities, right? And so I think to some extent, I look at this evidence and I say, we should be investing more in making it safer for women to give birth than to trying to give women this information that actually isn't as useful to them.
Totally, yeah. You just mentioned IUDs. Is that something you considered including in the program?
So one thing that ended up being a big question mark when we were looking at the studies and designing how to design the program was this question of how much to focus on particular contraceptive methods. Because one thing we found was that a lot of the studies had a big focus on postpartum IUDs and what's known as long-acting reversible contraception. So that could be things like implants. And what we found is that a lot of the studies, and especially a lot of the studies that showed really big increases in contraceptive uptake, had a big focus on IUDs. And one interesting technical note here is that you can actually get an IUD inserted immediately after you give birth. And the pro of this is you're kind of already up in there. You might be under anesthesia, anesthetic of some kind. And so it's actually relatively straightforward to insert that IUD. And so some people actually, for some experts, they're like, this is one of the biggest, best things about doing postpartum family planning is like you can insert these IUDs immediately post-birth. But there's also some issues about this, especially as relate to consent and coercion. And so I had this really surprising experience, which is I was talking to the authors of one of the big papers about postpartum IUDs. And this paper was like, postpartum IUDs are great. And we ran this great program. And then I had this call with one of the authors, and he said basically, I do not love postpartum IUDs, and I do not recommend including them in your program. And so that was really surprising.
Yeah.
But basically, he raised this concern about coercion, where especially in low and middle income countries, healthcare providers are seen as real authority figures. And folks maybe feel like they have less latitude to disagree with what a healthcare provider is suggesting. And then with IUDs, one thing that is true, but you might not reflect on, is that you can't get an IUD taken out unless you have a health provider involved. And so there have been some recent studies. And in fact, with these studies, they were so concerned about backlash that there's this study where they actually anonymize the name of the country that it's in.
Whoa.
Which is wild. I'd never seen that before. But in this study, they interviewed a bunch of people at clinics who would talk about experiences like they got an IUD, maybe they didn't super want it, or maybe they did want it, but then they changed their mind. And then they went in and they said, hey, I would like this IUD taken out. And the healthcare provider said, no, I won't take out that IUD.
Oh my God.
So this is terrible, total violation of people's rights. And this is an issue where it's really hard to say how prevalent it is because people are hesitant about raising this as an issue. But when we spoke to experts, it seemed like this was a real concern, especially with some of these programs. And I had noticed this when I read it in the studies. They would recruit people to the program they would go to women who are currently like in labor, although not in active labor. And then they would say, hey, do you want to get this IUD? But what you can easily imagine is a woman who, she's in labor, probably not 100% at maximum like intellectual capacity. And it might not be clear to her, like, is this medically necessary? Is the doctor telling me that I have to do this? And so they're recruiting women in these labor wards, and then they're inserting this postpartum IUD. And then there's this added concern of maybe they won't be able to get it out. And this is a big problem. And we were just like, wow, we do not want our program to look at anything like this.
That seems incredibly reasonable and very good.
Yeah. And I think there's this tragic irony here because autonomy is such a big reason to promote these types of programs. But I honestly have this concern, and my co-founder did a great job of raising this as a concern, of there's sometimes programs that couch themselves in terms of autonomy, but it sometimes feel like they're actually more about pressuring women to use family planning.
Yeah.
And I think given some of the ugly histories here, it's particularly important for development organizations to be really careful about this. And so what this ended up looking like for us is we said, okay, IUDs can be part of the mix, but we're not going to do immediate postpartum IUDs except where they're already happening. And what we want to develop a program that's about centering clients' preferences and what they want.
Okay, so you've talked a lot about how your thinking changed on postpartum family planning in particular. Did your take on family planning broadly shift at all?
It did shift. I think I'm less wildly optimistic about the space in general. I remain convinced that there are areas where there's really cost-effective opportunities, but I think that space is a lot narrower than I thought it was before. And I'm really aware of how careful you need to be to avoid buying into the hype, I suppose. And I think this goes back to one thing I mentioned earlier, which was there's a lot to be excited about in terms of autonomy and saying, hey, we can go beyond the health benefits. But I think digging into this deeper gave me a sense of part of why EA foregrounds the health benefits, which is that they're easier to make sure that they're not faked. Like those are harder to fake. If you look at this disease leads to this mortality burden, you prevent this disease, bam, those are hard numbers. But when you're looking at autonomy benefits, I had been enthused because I said, oh, hey, you can have these numbers for how many new users of contraception, how many pregnancies are averted. But it turns out that those numbers are actually much more complicated than you might initially think. So when you think, for example, about adding new users of contraception, when we were doing our geographic analysis and then going to visit clinics, I got the sense of there's a big difference between running a program that adds new contraceptive users in a context where their baseline access to contraception is really terrible, and in an area where their baseline access is actually half decent. So it's not just a matter of all new contraceptive users mean an equal level of agency. It's something like, oh yeah, if you're working in urban Ghana, where in areas where there's already a lot of access, that's just less useful, but it's really hard to capture that in a spreadsheet. So it's too easy to end up in a world where you say, oh man, we have 10,000 new users, we fixed everything, please fund us forever. And you don't want to end up in that world. I guess there's one more thing I just want to add because it's really interesting to me. Initially, I'd heard about these numbers, about the rates of unintended and unwanted pregnancies in low and middle income countries, and I'd been shocked and appalled and, wow, we need to take action on this, and maybe there's relatively light touch action can make a big difference. But I was surprised when I looked at stats from countries like the US at how the numbers are also not great there. So here's a stat for you. In the US, 42% of pregnancies are unintended or unwanted. So that's a lot. And so 27% of pregnancies are wanted later, quote unquote, and 18% of them are actively unwanted. And so, like, to me, that's just horrifying that that number is so high, despite how much infrastructure we have here. So to me, this doesn't suggest that the problem is less urgent. It just suggests that maybe the solutions are much harder than you might think at first glance.
Yeah. Just to check, I understand. Wanted later, is that something like you got pregnant, you didn't want to get pregnant, but over time you become happy that you got pregnant and had that baby?
So what they do is they survey women and they said, when you got pregnant, did you want to get pregnant at that time? Did you want to get pregnant, but not at that time in particular? Or did you not want the pregnancy at all? And these are really complicated questions. And I think women also feel internally complicated. So these numbers do fluctuate and there's a lot that's hard to pin down. But I do think these point to a general picture of, man, a lot of women don't feel like they're currently having the tools that they would like to have to make these choices fully. So I think it underlines the urgency of the problem, but also how tough of a problem it is to solve.
Yeah. Did you dig in at all to why it's 42% in the US?
Well, I mean, I can tell you that is higher than a lot of other high income countries. And especially right now, people have a lot of takes on specific policies that could be different. But I think that like there are not a lot of countries where this rate is 0, for example. I think there's a lot of challenges around this. I know some people are excited about maybe developing new tools that make it easier for women to control the reproductive futures, even new tools so that men can be more involved with the process. So like contraception for men. But this is a really big topic where like there's a lot of women in both high income countries and low and middle income countries where they look at the set of contraceptives available and they say, this doesn't really work that well for me. And so I think if you have a naive look at those unmet need numbers that I referenced at the very beginning, 1 in 10 women with an unmet need, a naive look says, hey, we should just run a bunch more programming and tell women about the options and then they'll all take them up. But what I realized over the course of the program is often women aren't taking up options, not because they don't know about them, but because it doesn't work for them. So for example, there's some forms of contraception, like the implant, that might cause bleeding irregularities in more than half of women who use them. And for some women, maybe in some Islamic countries, for example, like they don't feel comfortable praying when their bleeding is irregular. And so maybe they say, that's actually a no-go for me. But there hasn't been a ton of research into this. Like all of the side effects research, it tends to be focused on quote unquote like medical side effects. And it's taken less seriously. This might affect women's quality of life or their religious practice. So all of this is to say, this is an immensely complex area, and we have to be careful to not be naive about simple solutions to really complex problems.
Yeah, we could easily spend the next hour
infinite
talking about.
But thank you for letting me talk about that a little more, because it's so fascinating.
It is fascinating, and I genuinely feel shocked at what my family planning options are. They all suck, and it feels completely unacceptable, and yet here we are. Oh man, okay, so you're finding this, and I don't know. I think I'd be feeling stressed, frustrated, demoralized. What were you feeling at this point?
Yeah, I think I was feeling all of those things, but also confused. Like I just kept coming back to this factor of this is a complex situation. That like these are like, I'm sure it sounds complicated when I'm talking about it. It felt even more complicated to me when I'm trying to dig into these studies. And I kept consistently running into, I have this different take than the standard take. And I personally like to defer to experts a certain amount. But I just thought that the experts had this one wrong. And it goes back to what we were talking about before, about like, what's the chance that I've picked up on something that people haven't picked up on versus like that I'm wrong. And I think as I was working through this, I kept wrestling with this question of like, maybe I'm just completely off base. And I kept searching for like, maybe I'm missing something really obvious about why this is actually fine. So I think for me, it was just feeling uncertain, feeling confused, not knowing how much to trust myself. Plus feeling like, man, I kind of bet on the wrong horse here.
Oh, sounds really, really tough. So that at least was what sounds to me like a very solid hypothesis for why there was this kind of empirical disconnect between contraception and pregnancies. Yeah, where did you come out on this question of whether, at the end of the day, you should care about pregnancies as your outcome and not just contraception use for its own sake?
I think that family planning is valuable insofar as it empowers women to have more control over their reproductive lives. But I think if you have a program and it's showing that it's not changing the pregnancy rate at all, that suggests to me that you might be living in the world where the program actually just isn't providing a lot that's of value to women. So I don't think that like changing pregnancy rate is like the only useful part of increasing family planning uptake, right? But I think that it's suggestive that like maybe you're running a program that's like not that useful. And I do think that for us, we started with this prior of like the program has to prove that it's above the bar. And we can easily imagine, especially in the family planning space where like what the program looks like is like talking to women, giving them information. Like you can easily imagine a program that's not that useful, that's like not giving information to women that they want. And I think we felt like we were quite solidly in that world.
At this point, is it obvious what you want to do next? Or is there still a lot you're wrestling in thinking about where to go from here?
So we also spent a lot of time thinking about our personal considerations on the matter. So, I mean, what this looked like is it was some amount of personal reflection, some amount of discussion together. So we spent a lot of time doing individual reflection on these questions and reflecting on both, do we want to do postpartum family planning regardless of, how good it looks? And then this question of like, maybe we should pivot. So we spent a decent amount of time thinking about this because I think there is like often a very plausible case there. And I don't think my broader message is that all organizations, when things look at all bad, should immediately shut down, right? Like you have to think about like what comparative advantage does the org have? And so we thought about like, what's our comparative advantage? And after talking to a lot of people, we figured part of it was we had this specific knowledge and expertise of working in Ghana. Part of it was we had this knowledge and expertise of working on family planning programs, especially programs in health facilities. And also that, we were a strong team. We worked really well together. Despite the year and a half having a lot that was immensely painful, I think like the harder things got, the more confident I felt in my choice to work with Ben, just because he was so great to work with. We had a really high level of trust, and I think we could handle that conflict about the program well.
That's so wonderful.
So that part of it is great.
Yep.
But so we were thinking about these comparative advantages, and we didn't feel like there was an obvious we should definitely pivot from doing postpartum family planning in Ghana to doing this other health intervention in Ghana, or to doing a different facility-based family planning organization in like a different country.
Makes sense. Where did you land? What happened when you and Ben came back together?
We had a couple different moments of like, oh, we're going to make the provisional decision, then we're going to go off for Christmas and see how we feel after, and then we're going to circle back. And at every one of those points, we were both independently like, we don't feel like this makes sense anymore. We don't feel like we want to keep doing it.
How long had you been working on this at that point?
It was about a year and a half total.
It's such a long time.
Yeah, it's a long time. I felt pretty bad. I think I just kind of felt like a loser. Like I just felt like, oh man, this is such a reflection on me. And I would talk to people and they'd be like, no, it's not a reflection on you. It's just like this thing in the world and you couldn't control it. And I don't fully endorse that take, to be clear. Like, I think it was a lot. It was a lot of factors out in the world. And like, it's overestimating your own like agency over the world to be like, this is all about me.
Yeah.
But I think it just felt so intensely personal, and it felt like so much like we had made this bet and this was on us. And it just felt like, oh man, we totally messed up. Like, what if we'd started this other thing and it had been phenomenally good? Is it my fault? Like, should I feel guilty about the fact that we didn't help that many people? But if we had started this other program, we could have helped a lot more people. So it's like, should I feel personally responsible for those people? So yeah, it was not a great mental space to be in. And that was kind of a pretty depressing time, to be honest.
Yeah, no, it sounds awful. I mean, from my perspective, I think it's easy to have the outside view of like, this is just like the most laudable thing I can imagine in this space. You founded this charity that you thought was among the most cost-effective charities you could found. You had a bunch of like check-in points as you gathered more information about how well it was going to work in the actual world. When you got to a check-in point that showed more definitively that it wasn't going to do as much good as you hoped, you decided not to like keep at it because, you were afraid of disappointing everyone or disappointing yourselves or sunk cost fallacy. And I think that's incredible. But 1,000%, if I were in your shoes, I would be feeling like a failure. But I just again, sitting on the outside, I'm like, you're a hero.
I would not go that far. But no, I do appreciate it. And I think when I'm thinking about other people in this situation, I think it's easier for me to say, yeah, this is like a laudable course of events. But I think the simplest possible thing is I felt like it was my job to create a highly effective charity. I had not created a highly effective charity, and therefore it was a failure. But I definitely do in a broad sense, but not as applying to me. I do endorse the more positive take these days. But like, yeah, we should be honest about when things are going wrong, and we should shut them down rather than keeping going.
Did you have the sense that some of the charity entrepreneurship charities shut down, and that there were like quote unquote failures to come out of the incubation program, and that was a possible outcome?
Yeah, so there have been organizations that have shut down, and then like since we shut down, another actually organization from our cohort also shut down. But before we had shut down, it was generally either because basically because things had gone wrong quite early on, and there wasn't a clear-cut example of someone saying this just doesn't work as well as we'd hoped, and so we're going to shut down and just leave it as that. I do think the folks at Charity Entrepreneurship kind of wanted this to be more of a thing because I think they do have this genuine bets-based mindset. And I don't want to put words in their mouth, but my sense of it is that the ideal is you start a bunch of charities, they test stuff out, and then some of them turn out to be phenomenally effective, and you want to, scale those up as fast as possible. Some of them turn out to not work out at all, and you want to shut those down as quickly as possible. And then there's a lot of disagreement about what you do in the middle cases. So some people would say, if it's not going to be the most effective thing, then you should shut it down. Some people would say, well, it depends on where you get your funding from. But I think like one of the reasons I took this so hard is because entrepreneurship is all about this bets-based mindset. So you say, hey, I'm going to take a bunch of bets. I'm going to take some risky bets that have really high upside. And this is like a winning strategy in life, but maybe it's not a winning strategy for like any given hand. And so like the fact of the matter is that like I believe that intellectually, but like I do not believe that emotionally. And I have now met a bunch of people who are really good at doing that emotionally. And I've realized I'm just not one of those people. Like I think I'm more entrepreneurial than your average person. I don't think I'm the maximally entrepreneurial person. And I also think it's just human nature to not like failing. So,
Yeah, it feels like it's one of these cases where the optimal thing might be to have, a bunch of people make these bets and have some massively pay off and some not pay off and fail. And on the whole, that's a great strategy. And everyone participating should like get some credit for the wins because they're like participating in the system that overall has this really valuable high payoff strategy. But individually, the people who like make the really successful charities with high cost effectiveness get to feel that win very viscerally. And the people who don't feel like they've lost, despite it being a thing that was like maybe the best thing for the world. And it just feels incredibly unfair and really, really difficult and painful. And yeah, I'm both like grateful to you for participating. I'm also like, yeah, like outraged or not quite outraged, but I feel like indignant that there are cases where this strategy is optimal and people have to, I think it is really applicable for careers and the thing 80,000 hours is about. We're telling a bunch of people to be really ambitious with their careers. And it does make me feel really pained that for some, despite it being the optimal thing that they took a really big career bet, they will feel like they failed. But that's like still part of, I don't know, the like portfolio we want to have. So just a massive thank you.
I appreciate it.
And well done. But obviously it felt really painful. So again, this is about 18 months in. At this point, a bunch of people know that you're doing this. Probably your family and friends know that you're doing this. People in your professional network, as well as everyone at Charity Entrepreneurship. Yeah, how worried were you about kind of announcing the fact that you were shutting down?
I was not looking forward to it. I guess I was kind of torn on like how much I genuinely believed the I'm a total failure, everyone will think horribly of me mindset. So like probably part of me genuinely believed this, and part of me was like, people will think that it's like doesn't reflect great on you, but that it's kind of okay. But I think my overall take was that people would be disappointed in us shutting down, but also that they wouldn't be super interested in it as a topic. So Ben was working on this post for the EA forum about our shutdown, and he was really investing into this post. He was working on it. And there was a part of me that wanted to say, like, I really don't think that many people will read the post. Like, maybe you should work on other stuff. But I felt like, well, it's the end of the project. You know, we don't need to optimize as much. Like, if it makes him feel better, like, he can work on it. And then we posted it, and it got this incredible response. And I was so surprised. I was like, we're this tiny org that no one cares about. Like, why does anyone find this interesting? And then I think I was surprised that people thought that it demonstrated integrity rather than kind of loserness to be shutting down. And I was also really excited about the fact that people like thought that this was an opportunity to think about the lessons.
Yeah, I guess kind of building off of what we've just said, it feels like a nice, almost like solution to this problem where we're asking people to make big bets. Some of the people's bets won't pay off, and we can still give them hopefully this big reward and appreciation, and thank you. So I'm really glad people were interested.
Yeah, I think part of the reason I was surprised that people responded the way that they did is because I think to us, shutting down, though it was very painful, it felt quite natural. And it actually, in some ways, felt like the choice that like maximized our own well-being. Because, for example, people would say things like, oh, it's admirable that you shut down because I can easily imagine you continuing going for months or years. You know, I mean, those postnatal care results, we could have said, hey, in this one facility, we saw this really big uptake. We're going to keep going. And I think Ben and I just didn't feel that way at all. Like, to us, the stress of running a program, like the way it felt for like the first year where we were uncertain about how successful it was and we had these nagging doubts, that was not a great feeling. And then like the feeling we had once we were like, oh, this probably isn't great. Like that was such a terrible feeling that I think to us, we just like couldn't conceive of what it would look like to run a program you weren't totally bought into.
Right. You weren't that actually tempted to just like stick with it out of the desire to not quit.
Yeah, absolutely.
You were like, no, I actually just don't want to keep doing this.
I mean, because if you think about how exhausting it is to run a new program, and then that's assuming that it's going to potentially be really good. Now it's like, imagine running a new program, but like you think it's actually not helping people that much. And assuming that you're living in a world where there is counterfactual funding and you really believe in that. And I do really believe in that, where people funded our project and they could have instead funded our friends' projects, which also looked really exciting. So I'm living in this world where I have this burden of, I feel like we have to be constantly living up to running a program that's good enough for that money. And if that program is worse off, then like maybe instead of sacrificing a bunch to make the world better, I am sacrificing a bunch and then actively making the world worse because we're not spending this money well. And so I think that just to us was like such an ick factor that we were not at all tempted to continue operating if we thought it didn't work. Like the main question was, maybe it does work. But yeah, we didn't want to run a program that didn't work. And I think that felt so natural to us that it was surprising to us that people would think differently.
Yeah. Yeah, in general, how have you felt about the decision since making it? Was that kind of late 2023, early 2024?
Yeah, so we formally decided in like the end of January to shut down. And I would say, because after we made the decision, it wasn't like, bam, we have immediately closed our doors. Like there was a lot of work we had to do in terms of shutting down the ops, but then also working to publish our results. So we're trying to publish multiple papers about the work. We wrote this article in Asterisk about it, but just like the nuts and bolts of what happens to this money now, what happens to these parts of the organization. So there was 2 or 3 months where we were still working on shutting it down. And then I took a bit of a break. And I think early on, it felt like this real kind of, this anvil dragging me down of, I still have to keep working on this thing and I feel embarrassed and ashamed about how it turned out. But I think once I was able to actually like, you know, shut the laptop and go take a bit of a break, I started feeling a little bit better. And I think when I think back on the, I don't know, whatever, it's been 8 months since we fully shut down, there have been times when I've second guessed my exact take on postpartum family planning. So like I feel confident that it doesn't meet the bar for being among the most cost-effective charities. But I'm still uncertain about like exactly how good or bad it is. There's these hard judgment calls about postpartum abstinence, all this. So I've like thought about that a bit and wrestled with that a bit. But there hasn't been a single moment where I've thought, no, we should have kept going with MHI. No, we should have kept running postpartum family planning programming. And that's honestly a surprise to me. Like I thought that I would feel more doubt about it.
More ambivalent. Yeah. Okay. So you had these kind of social worries. Did you also have professional ones? Were you worried this would kind of hurt your career?
Yeah, I figured that it would be somewhat bad. Like, I mean, in general, you would rather be associated with a good project than a bad project. And so I assumed it would be like somewhat bad, but people might be like, hey, well, you seem like vaguely competent in that you could run some of this. It seems kind of bad that you shut it down and couldn't make it work well enough, but whatever. So I definitely had professional concerns, but it seemed wrong to think of that as at all of a factor in the like deciding to shut down. So I was just like, I have to bite this bullet. And then I think this is kind of like opposite of played out. Like I'm on this podcast, for example, which like probably wouldn't have happened even if the project had been really successful. So it's been really unexpected to me the way that people have responded and interpreted it.
I love that. I think that's great. I also think it would be good if you got recognition, obviously, if the thing had succeeded. But I'm actually, I feel good about the community around you for recognizing the kind of bravery, integrity, self-awareness, judgment to make the decision you did and still be a badass human. Okay, so if you're open to it, I'm interested in talking a bit about whether you think you made any mistakes worth learning from during this experience. So obviously, you know so much now that you didn't know then. But do you think that you and Ben made mistakes that you reasonably could have avoided at the time?
I mean, we made a ton of mistakes. It's harder to figure out for any given mistake. Like, could we reasonably have avoided it to stop thinking about hindsight? But when we were shutting down, we ran this process of trying to think about what were our biggest mistakes, kind of prioritize our mistakes. Can we learn from this? And I think there were some consistent themes that emerged. So where we were making similar classes of mistakes repeatedly. And I think probably the biggest consistent mistake that we made was insufficient prioritization. So the EA approach is all about prioritization. So you might think, oh, hey, we've got prioritization down pat. But I think there's a lot of ways that prioritization plays out on a concrete day-to-day basis. And I think one difficulty was that when we were starting and we had newly become, charity directors, we were trying to figure out what does it look like to run a nonprofit? And I think one way that I thought about this was, well, what do I imagine that might be the task that kind of person would do? And so we made these objectives and key results for different areas of the organization. So we say, what should we be doing in fundraising this quarter? What should we be doing in communications this quarter? And so we had all these ideas for things that seemed pretty useful. It would be pretty useful to have a nice looking website rather than the absolute bare bones. It would be pretty useful to start doing some applications for funding. And part of it was I didn't know exactly what I was supposed to be doing. And I lived in fear of waking up 6 months from now and thinking, oh my gosh, we haven't applied for funding. We should have obviously applied for funding. But what we came to realize is that your time is so limited and that the class of things that it's incredibly important to get right is at the core of what you're doing. We realize that you have zero time to spend on tasks that seem kind of useful. You have to ruthlessly prioritize and only spend your time on the activities that are going to cash out in making the most important parts of the organization work. So for example, I wish in hindsight that I'd said, we have enough funding for the next year and a half. I'm going to spend 0% of my brain thinking about funding for at least the next 6 months, probably the next year. And we would have been totally fine.
Yeah. What would you have done instead?
Well, for us, the most urgent thing was, can we make this intervention work? And we found that there was so much that we could do, either regarding desk research, looking into what had made previous interventions work, being on the ground and talking to folks. I would categorize this as another one of our big mistakes, was not focusing on learning more on the ground at the outset. Because in that fall, we had a big discussion about how much time should we be spending on the ground? Because there's one model of this in which you say, hey, we're running a charity in Ghana. Therefore, both co-founders should go immediately move to Ghana and just be in Ghana into the future. And then there's another model of this where you say, well, we have an implementation partner. They'll mainly be on the ground. We'll go occasionally. And so we tried to do our best to make this decision. We talked to people who'd run similar organizations, and we found a broad range of what people were saying. And so I think at the time, if we had thought it's essential to make the charity do better to be on the ground, we would have done it. But I think we made the wrong call in saying that we didn't think it was essential. Like, I think it would have been really helpful just to spend more time in clinics, more time understanding exactly what's going on the ground, because that is so essential. Because in order to design a program, I think it's easy to get stuck in the oh, I'll read a lot of studies. But ultimately, you are designing a program for a specific context. And the best thing you can do to make that program better is to combine the stuff from the studies with actual on-the-ground information.
Yeah, this is something I've wondered about for charity entrepreneurship charities. I think sometimes people do have ties to the places where they're founding the charity, but it seems like often they don't. Does this seem like in a patterned way it could cause problems where I guess you're less familiar at the outset with the place, but also, yeah, people don't necessarily want to completely uproot their lives and move to a country, often with more dire health or economic problems than their own.
Right. So I think you're pointing at a real difference in how different groups of people think about this, where one critique that charity entrepreneurship has received is from some folks who say, you shouldn't have foreign founders. You should have a founder who's from that country, who speaks the language, who has deep ties to that country. And I know actually there's some funders, actually a number of funders, who will only fund local groups, or if you're of a particular gender identity, national identity. And I think actually I would disagree with that exact approach to it, because I think, for example, if you look at a country like Ghana, there is so much diversity within the country that you could easily have someone who's from Ghana, but maybe they're from the coastal regions and speak one language. And actually, they're going to be running a program that's in the northern regions where there's an entirely different language. And I think the important thing here isn't if you come from that country, but if you spend a lot of time in the context. And it's not just about the context of the country, but the context of the environment you're working in. So I wish I'd just spent a lot of time there and parked myself in a hospital and learned as much as I could, spent time in maternity wards. And part of this is it's tough to do that. It's tough to get permission. You show up at the hospital and they say, who are you? You need permission. You can only come on certain days. But I think that this kind of learning helps you make a program that's more rooted in the actual realities of what's going on. Because this points to other decisions that we made, which is we actually, over the course of our time in Ghana, worked at 18 different facilities, which to us felt quite natural because we were always thinking about scaling up. We're oh, we want a diverse mix of facilities. We want to make sure we're not over updating. But in retrospect, I wish that we'd picked one facility and kind of embedded ourselves at that facility and iterated with making the program work, getting to know people there really closely. And I think that just would have given us a lot more information than the approach that we took. So I think one thing I realized is that one essential trait is figuring out how much to update on different experts' advice, because what you find is that experts tell you a bunch of different stuff, and then you say, how much should I trust this expert on this versus on that? And so I think for us, we updated too much on charities that were doing very different types of interventions. And so there were some charities that had a lot of success with not being on the ground. And when they spent time on the ground, they felt and sometimes that was even detracting, right? So I think this is really tough.
Yeah. Okay. Yep. That makes sense. Okay. So not prioritizing spending more time on the ground and in the facilities in particular, in general, not prioritizing harder. Any other kind of categories of mistakes that you think might have been mistakes looking back now?
I think those are the biggest ones. I mean, a lot of mistakes, but maybe just less interesting to learn from mistakes.
Okay. You chose the wrong webcams.
Yeah, exactly.
Yep. Yeah. On prioritizing, that one feels, I hate having to ruthlessly prioritize. It's not fun to be like, oh, there are a bunch of really good things we can do, but they're just not good enough. And you have to say no to literally everything that isn't the best thing you could do.
Absolutely. And I think sometimes there's this idea that part of being an entrepreneur is about iterating and being creative and doing all these different exciting and new things. So I think sometimes I felt like we were doing what we were supposed to do and doing these creative and innovative and interesting things. But one thing that I learned is that if you're looking at a long to-do list, the single best thing you can do to achieve that to-do list is to cross a bunch of things off the to-do list without doing them and say, this is not the best use of my time, because you have to remain focused on what you're there to do. And often what you're there to do is really, really hard, and you're better served taking the top 4 most important things from your to-do list and spending 80% of your energy there, and then either delegating the rest of it or just crossing it off the to-do list and saying, we can figure this out later.
Okay. Were there any points where, like, I guess you've described these moments of yellow flags where, like, I don't know, you learned about postnatal abstinence, or you started hearing from people in the facilities that women already had the contraception they wanted. Looking back at those, do you have any feeling of like, oh, I really just should have pivoted then? Or do you feel like, you know what? I can kick myself all day for it, but actually with the knowledge I had at the time, I made sensible choices?
I continue to be genuinely uncertain about this question. I think back to the decisions we made about having those bad gut feelings in Ghana, having these bad gut feelings about aspects such as postpartum abstinence. And I don't know. I do think that persistently, we didn't have the best approach for responding to these kinds of anxieties. I think often what happened is there would be an anxiety and I would kind of freak out about it. I would let it dominate my thinking, or maybe I'd try to push it aside, but it was making me stressed all the time. And so I'd be in these other meetings, but I'd really be thinking about this thing. And then I'd be also doubting myself for trying to shelve it. And then we would spend time working on it. But I think the time we spent working on it, we didn't spend as efficiently as we could have. So we spent too much time in desk research and discussion and not enough time in talking to experts in a way in which we were willing to sound silly or be asking things that might be considered dumb questions. And so in retrospect, I think I mainly wish I'd changed the process. Like, I wish that I'd started from the beginning, because we started doing this later, just having a document where it's like miscellaneous concerns, right? And then something happens, and then just kind of file it in that document, say, this thing happened, it's related to this overall ongoing concern we have. And maybe I'm in the middle of a meeting and I'm just going to throw it in that document, and then I'm going to go and focus on what's right in front of you. And then have a time that was like preset, but not all of the time, where we would come, once a quarter and say, we're going to look at these concerns. And as time went on, I think we were better about saying, hey, after the pilot, we're going to come back to these questions. But I think I don't love our process. And when it comes to whether we should have responded differently to those red flags at the beginning, I still don't know, man. If anyone has takes on this, feel free to tell me, and maybe I can feel better or worse in retrospect. But I think ultimately I just come back to this framework of, we were trying to do something that's tough and complicated. And I think we were making a reasonable effort. We were definitely making mistakes along the way, but I think you have to give yourself a bit of grace when you're doing something that's really tough and complicated.
100%. Yeah. Yeah. Have you shared any of your results with organizations working on postpartum family planning still?
We have. When we came to this conclusion that we had changed our mind on the intervention, we were immediately thinking, well, what can we do that's useful with these results? We don't want to just shut down, say nothing about it, and then things continue on in the world unchanged. We wanted the chance to share our results and maybe potentially affect how some folks think about it, maybe change how some folks direct funding. And so what we did is we worked on writing up our results, making some reports. By the way, if you're interested, we have more information on our website if you want to dig into the weeds on this. But what we did is we approached a couple of the major funders of postpartum family planning and met with some of them to share some of our results, to say, hey, we think that the field is missing some aspects of what makes these interventions have an effect on people's lives. We have some concerns about these interventions. We just wanted to start the process of sharing this information.
Yeah. Actually, I was going to ask how they've responded. I'm also just curious, is this a big part of some funders' portfolios? How common is it that funders are trying to fund postpartum family planning in particular?
That's a great question. So it's a pretty well-regarded intervention, and it's considered one of the priority focus areas for global family planning funders. So I can't give you an exact number, but if I had to guess, somewhere in the neighborhood of tens of millions of dollars per year. So definitely real money going there. In terms of how folks have responded, a lot of these discussions are still in progress. So somewhat TBD. I would say there's a lot of skepticism, and I think folks often come at this from such a different perspective that they're just thinking about it in very different terms. But I can tell you, for example, I had one call with someone who is really committed to evidence-based approaches, is embedded at one of these funders, and was giving me advice on how to talk to them. And I talked her through, our beliefs on this, the evidence base, why we think it's less effective. And she said to me point blank, you can't frame it like this to the funders. You can't say, we don't think this intervention works very well. That's just not how they think about things. Like, there's not a world in which they can spend less funding on this and instead direct the money to something else. And I was kind of confused by this. I was like, what do you mean there isn't a world? Like, is there no control over where the funding goes? And she was like, it just doesn't work like that. You can't move the money around like that. And I honestly was just not super convinced by this, but it was such a fascinating perspective.
Huh. So like in theory, the money could have been moved, but in practice, there was no one who was going to be open to this thing doesn't work. The studies actually say there's no effect on unwanted pregnancies. And so let's fund something else. That just wasn't going to happen.
That's my best guess on it. I think it's just really interesting because I think a lot comes down to what is your fundamental perspective on the development space? Do you have this perspective where you're saying our funding is limited, we need to be in triage mode? If we're spending more on intervention A, we have to spend less on intervention B, so therefore we should prioritize between them? Or do you have this perspective of there's a lot of different ways of doing good in the world. The world is really messy and complex, so we can't really compare between them. Studies don't tell us a lot. Therefore, let's just kind of keep funding the stuff that seems vaguely good, and let's not spend less on some areas. I'm obviously extremely bought into that first mindset, so I'm not the best person to provide a defense of the second mindset. But I do think a lot of the resistance that we've encountered just comes from people seeing the world in a fundamentally different way. And it's kind of a bummer to me. It feels really frustrating, and it feels like letting down the beneficiaries. If there are these better ways of helping them, which I genuinely believe is true, then I think we owe it to them to invest in those better ways. But there's a disconnect in approaches.
So after you had this conversation with this person, did you then try to convince anyone, or did you try a different framing? Or are you accepting that you might not be able to move any of the people who are going to make these decisions?
I think we've thought a lot about framing, and we want to frame it in the way that's most likely to be effective rather than necessarily the way that we most believe in, because that's just how things work. I would say I think that there is fundamental value in trying to create more of a conversation about these studies. I think despite the fact that there is a disconnect in attitudes, I think people do care a lot about actually making things happen in the world. And so, look, I don't think that tomorrow big orgs are going to turn around and say we're going to stop funding postpartum family planning. But I think having these conversations is worthwhile. It's a long journey. I feel optimistic that some changes will happen, pessimistic that radical changes will happen, and we're just going to do our best.
Okay, yeah. What sorts of framings are you trying that you hope might be kind of more effective for this audience?
Yeah, I think there's several different framings. I think one approach is to really foreground the autonomy side of this and to not talk about unintended pregnancies in and of themselves, but talk about like the feedback that we've gotten from beneficiaries where they say, oh, we don't feel like this is the best use of our time, where, maybe they're hungry for information at different sorts of touch points, and really focusing on, how can we shift money to more effective areas that are doing similar things in family planning, but maybe not at this exact touch point. One thing I'll just throw in here that is its own rabbit hole of its own is that we have seen some preliminary evidence that approaches to preventing short-spaced pregnancies that are focused on community-based programs, so programs involving community health workers going into women's homes, programs that are heavier touch, where maybe they're visiting for 6 times in the first year post-birth, rather than just having this light touch interaction at a health facility. There's a couple of studies on this that have shown robust decreases in short-spaced pregnancies, and that's really exciting. I don't feel like there's enough evidence to say, like, man, this is the solution. And frankly, this is a tiny, tiny fraction of the current funding that goes into postpartum family planning, because I think a lot of funders really love this idea of light touch, just adding it into existing touch points. But one thing we've talked about with funders is, hey, some of these community programs look promising. And I'm not sure. Okay, I'm very skeptical that they're cost competitive with the most effective health charities, right? But they do show evidence of actually being effective in an end-lined way, which is not true of facility-based family planning. So comparatively, I do think that they're a better bet.
Yeah. And so if someone is committed to putting their funding into family planning to avert short-spaced
pregnancies. Yeah, this is the best short-spaced pregnancies bet, in my opinion.
Yeah, it strikes me that charities seem to scale back or shut down at potentially like a much lower rate than like businesses. And that seems bad. It seems like businesses have some incentives that don't always lead to incredible outcomes, but they are probably tracking something like whether they provide value. And if charities aren't shutting down nearly as often, that might suggest something about too many existing that aren't providing much value. Does that seem true to you?
So I think you're pointing to the most important factor here, which is that structurally, charities are built in such a way that your expectation on priors would be that a lot of them would just be doing stuff that's not very useful. Because the difference is that the way a business works is, at least in an ideal case, a business provides a product or a service to their consumers. If that product or service isn't very good, then unless there's monopoly or something wonky going on, consumers stop purchasing that product and, that business goes out of business. But what happens is that instead of it being dual when it comes to charities, it's actually this triangle. So on one point, you have the charity. On one point, you have its beneficiaries, but then on another point, you have the donor. And in some ways, the donor ends up having most of the power in some ways, because if the donor is the one that's giving the money to make this program happen, and you're the charity, and you're looking there at your beneficiaries, and you're looking there at your donor, and you're saying, if the donor doesn't like what we're doing, the program can't happen. But if the beneficiaries don't like what's going on, as long as the donor keeps liking this can keep happening. And to be clear, I'm not saying that, charity founders are sitting there saying, wah, ha, 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 I'm going to do bad things for my beneficiaries. I think, nearly all charity founders are really well-intentioned and are trying to make the world better. But you end up in this structural space where you are structurally incentivized to make your donors as happy as possible. And then you're only really incentivized to make sure you're helping the beneficiaries insofar as the donor cares about it. And so maybe the donor, wants to see photos of happy seeming beneficiaries. Maybe they want to see studies of this program is really effective. Maybe they want to see ongoing monitoring and evaluation data. But depending on what they demand, things could look very different on the ground. And of course, organizations can also demand these things. But in general, I think funders are often the ones who have the most leverage.
Yeah, so it seems like one solution is focusing more on outcomes for beneficiaries and like really trying to figure out some incentive structure that means that like the actual thing that you're measuring and holding yourself accountable as an organization is the beneficiaries getting the thing that you think is valuable for them and that they hopefully say is valuable for them. But there's been this huge backlash against the randomista movement, which tries to kind of forefront outcomes. So conducting randomized control trials to kind of better measure the actual impacts of global health and development programs. And I guess, yeah, you pointed out in the article that you co-wrote with Ben, which is an asterisk and which we'll link to, that there's this kind of new move toward what's called trust-based philanthropy, which is a term I actually hadn't heard before. But yeah, can you talk about what trust-based philanthropy is and I guess maybe what the best case for it is?
Absolutely. I'm really glad you brought this up because in some ways, I think that trust-based philanthropy emerged in response to this really important, really urgent problem in the nonprofit sector. And it's the part of this problem that I'm talking about. But I actually don't think that it fully goes all the way in trying to fix that problem. So my relationship with it is I'm like, oh, wow, I'm really excited you're pointing to this problem, but I don't totally agree with all the ways that you're trying to fix the problem. So trust-based philanthropy is one of the biggest forces in philanthropy right now. Like if you go to a conference on philanthropy, people will use trust-based philanthropy language. It's gotten a lot of acclaim and I think is very much in the philanthropy water in a way that I did not fully understand until I both started like talking to some donors and also doing some research on this. And so trust-based philanthropy burst into wider awareness in the US around some of the racial justice protests a couple years ago. And it's very much rooted in this idea of we need to equalize the balance of power between donors and nonprofits and the communities they served. And it points to this really important thing, which is that like it seems wrong for donors to have a disproportionate amount of power. And if they're trying to improve things in the communities that they serve, that's only going to happen when there's this partnership of equals among donors and nonprofits and their beneficiaries. And so what does that actually mean in practice? Well, that's the trillion-dollar question. And I will say, I get the sense that in practice, sometimes this just means like using different words to describe the same thing happening as it was before. But a lot of the shift that you see in practice is about reducing these burdensome reporting requirements that charities have to do for their donors. And so the fact of the matter is that a lot of donors, especially if it's money from like government development agencies rather than from private donors, they'll require this ridiculously long list of reporting requirements. So they want you to report on like, this is exactly how we use the budget. And this is like exactly what we did for this program. And obviously, like maybe you're listening and you're thinking, oh, that makes sense. But somehow many organizations manage to do this in the most aggravating and time consuming possible way. So I remember talking to another charity about a big grant that they'd gotten. And they said, yeah, maybe you should apply for this grant, but just like heads up, we had to hire a part-time operational person for a full year solely to do the reporting requirements for this one grant.
Wow.
Because they would make them fill out all these forms. And if you didn't do it exactly the right way, they would take away your money. And so like reporting requirements are like a huge headache for a lot of nonprofits. And I think this is actually like less known in many effective altruist charities because actually many like EA donors actually operate in a way that's very much like the trust-based philanthropy approach, which I suppose I haven't even gotten to, which is just saying, hey, maybe we should make these reporting requirements less onerous. And I fully endorse many aspects of that because I think there's a lot of ridiculous time that's spent on reporting that like ultimately just makes the funders feel better, like, oh, we're doing our due diligence to get you to do it in this detailed way. But really for years, nonprofits have been saying, oh my gosh, can you just make this easier for me? But maybe not even saying that to donors because they're afraid to say that to donors because then maybe the donors will take away their money. So lessening reporting requirements is a big part of this. And some donors have gone very far in that direction. So Mackenzie Scott has become one of the biggest philanthropists in the world. And I don't even think many people are aware of the full extent of her grant making. But over the last 4 years, she has given, I think, more than $17 billion to nonprofits. Probably that number will be outdated by the time that you release this podcast, because she's just dispersing ginormous amounts of money. And she doesn't have a huge staff. I don't know actually how many staff she has. But like, if you would do that under the normal reporting requirements, you would require like the world's most ginormous foundation. But what she's done is she has been giving this money out with absolutely zero strings attached, at least to my knowledge. And often she doesn't even talk to the nonprofits ahead of time. So she'll like, I mean, I don't know how this actually works, right? But I think it's something along the lines of like the head of the Boys and Girls Club in Boston gets an email and says, hey, Mackenzie Scott wants to give you $1 million. No strings attached. It'll be in your bank account next Tuesday, right? And so in some ways, this is a big win because charities have to spend less time on these reporting requirements. They have to spend less time, trying to figure out exactly what does this donor want from me, cultivating these relationships. But I also have worries about this because I think in some ways this approach conflates the nonprofits with the beneficiaries themselves, right? Because trust-based philanthropy in some ways boils down to trusting nonprofits to do what's best for the beneficiaries. And I think that you can think that people who run nonprofits are like really well-intentioned and great and you should be friendly and make their lives easier, but also think like, hey, maybe it's better for everyone involved if we have some ways of making sure that that money is actually helping the beneficiaries lead better lives.
Yeah, it does sound really nice in theory. What is your best guess at how to solve this, like how to give power to beneficiaries in particular?
Right. So I don't have a 5-point plan to fix philanthropy.
Yeah. It's a tall order.
But I do think there's a couple ways of going about this. So first of all, if you're really focused on, I just want to empower beneficiaries as much as possible, like if that's your biggest priority, I think the best thing you can do is direct cash transfers. And I think that organizations like Give Directly, they've set it up in a way that, mostly gets rid of concerns about corruption, that makes sure it's going to folks who are the neediest around the world. And I think I am eagerly waiting for the moment in which people who are really focused on empowering beneficiaries start adopting cash as one really promising approach, because I think it's such an exciting approach. Like when I think about like ways to empower beneficiaries, it's like one approach is like, oh, well, maybe they're on a committee that helps decide where some of these charities funds go on and they have these long discussions. And it's like, okay, that seems like maybe vaguely useful, but it also seems really easy for that to end up in a failure mode where it doesn't actually make that much of a difference. And on the other hand, if you just send people money, like they can do whatever they want with that money. And a lot of studies have shown that people in extreme poverty tend to really reliably use that money on stuff that's meaningfully improves their lives. But I think that if you care about how can we empower people to do what they want to improve their own lives, then just giving it to them directly and bypassing the nonprofits entirely, not to put myself out of a job, but like that is maybe just the simplest, best possible way. Give them the money directly.
Yeah. I mean, I'm a huge fan of Give Directly and of that intervention. I guess you've kind of pointed at one of the potential ramifications, which is putting a bunch of charities out of the job. And I guess, do you have an image for how this happens? Like, if you actually kind of follow this to the logical conclusion, you probably see a bunch of charities shut down. And what does that actually look like that doesn't feel horrible to a bunch of people actually at charities working and hoping to do good work?
I think in my ideal world, there would be a lot more money that's directly going to cash. And what that means is not that like everyone who works at a charity is out of a job, but that instead they can be working on the interventions that are like most impactful to help improve those people's lives. And so I think in my world, what that looks like is not like, oh, there are zero charities. I mean, unless we're living in our like ideal world, right? But that there's charities that have different focus areas and that maybe have a different approach to monitoring and evaluation. And I think that that's a really exciting future for both beneficiaries and the people working at charities, because like 99.9% of people who are working at charities are there because they want to help people. So to me, this idea of we can help more people better, like that is in fact a win-win.
Totally. Yeah. I guess when I try to imagine how this ends up happening in a way that isn't kind of devastating, it's like there is some kind of cultural shift where people working on nonprofits look really critically at the intervention they're implementing, as you have, and some of them realize that the thing that they're doing is not as good as other things that they could be doing or that another charity is already doing. And they make this decision that you've kind of made to either shut down a program or shut down themselves. But it seems, that just seems like such an incredibly difficult ask. And it seems like MHI was in some ways kind of one of the easier cases of shutdown. You had 3 employees. You had people around you who celebrated the decision to shut down as a wise one, rather than, I guess, considering it just a complete failure or disappointment, which is just, less true in much of the world, unfortunately. How realistic is it to think that nonprofits will shut down programs with 30 plus employees and that don't have that culture? Or even entirely shut down their organization.
So I absolutely agree with the premise, like that this is a tough challenge and one that is not going to be solved in a day. I think that reframing it from shutting down to shifting program focus areas or shifting people from one program to another program is a really helpful way of thinking about this. And I think one interesting example for this is new incentives, which provides conditional cash transfers to help incentivize immunizations. And you may have heard of new incentives because right now it's doing really well. It's one of GiveWell's top charities. It's widely recommended. But what you might not know is that when new incentives originally started, they were doing a very different program. So their founder was really excited about conditional cash transfers to help reduce poverty. And she was originally focused on, I think it was cash transfers to prevent mother-to-child HIV transmission. And so she was working in Nigeria, and they were working in a bunch of clinics, and it was going decently. But they realized, oh, actually, things look different than we'd originally thought, and we're really not going to be able to scale up with this program. And so, they'd been operating for a couple of years. It had been going kind of well. And I think they faced this fork in the road. I wasn't involved at all, but my sense is they faced this fork in the road of, should we keep going with this program that we think is decent, or should we try to pivot to something else? And I can imagine them, sitting in the room trying to figure out, like, wow, this is a really tough decision. We have a lot of staff who might be affected. What's going to happen? And what they ended up saying is, look, we are here to make a cost-effective, impactful charity, and we want to focus on the most useful thing. So they ended up pivoting. They pivoted to these cash transfers for immunization. They ran an RCT. It turned out really well. And then they massively scaled. So they went from like a small number of employees. So I think they now have more than 3,000 employees in Nigeria.
Wow. Holy crap. I did not know that.
And so pivoting is what allowed them to unlock their potential as an organization.
Nice.
And so I think that this is a lot about how we frame this conversation. Are we framing this as more people should do the painful and unpleasant thing of shutting down? Or do we frame this as more people should look at the exciting opportunities of pivoting their programs to things that can help more people? And I think there are tough calls, especially when it comes to, are people going to lose their job? Speaking as someone who kind of fired myself recently, I think especially when I was 4 months into job searching, I was like, this sucks more than I realized. And man, I can't believe I fired myself.
Job searching is the worst.
Yeah, I think if you make it easier for people to pivot jobs, that really helps. Or if you provide them a different job within the organization. And I think this is an area where it actually makes a big difference how you think about hiring people. So I can tell you when I was job searching, I was looking at a bunch of different organizations. Some of them were more EA impact focused, some of them less so. And I can tell you that there was a lot of organizations where I'd see an organization, I'd be like, oh, cool, this job looks cool. I think I could be good at it. And then I'd look and the requirement would be like, oh, you have to have worked for the last 5 years in this specific focus area. So you have to have worked in nutrition, or you have to have worked in malaria. Or it might say oh, you have to have a master's degree in this specific focus area, right? And there is value in trying to select people based on their domain expertise, right? But I think that makes it a lot harder for people to move around. I think that makes it a lot harder for people to implicitly question the value of that domain area of expertise. And so I think this is one thing that effective altruism does well, although maybe sometimes does too much, is saying like, we want to hire exciting, competent generalists and we don't care about their backgrounds. I think sometimes EA goes too far with this, but I think it makes it possible for people to move around, for people to fundamentally question, is this domain area the best way of helping people? And so I think that's something that every organization should think about the trade-offs of that when they're thinking about how to hire folks.
Yeah, I agree. It's hard to find the balance, but I do think there's something about not having everyone in your organization have their identity staked in exactly that particular intervention that you're implementing.
Absolutely.
Yeah. I think thinking about your career can also have some parallels here. So I think 80,000 Hours recommends lots of people try out a particular career path. And then lots of those people have to figure out, like, is this the right thing? Should I keep investing in this thing and making this bet? And sometimes they have to decide, actually, no, I shouldn't continue down that career path. So I think this is actually this question of how to decide whether to like double down or pivot is really, really important and really broadly applicable. How do you think that, I guess, organizations, but also individuals should think about how and whether to continue on their bet or pivot, do something else?
I think that's a great question. It's certainly something I think about all the time. I think the most important part is to think clearly about what path you're on, what the different assumptions are that would suggest that that's a really good path, and try to dig into, are there ways that you could try and test those assumptions? What is the balance of the evidence in one direction or the other that suggests that maybe this is a really good path or maybe this is a bad path? So kind of thinking really clearly about this. For me, I think that usually looks like a spreadsheet. So I know for postpartum, I made this big spreadsheet that was like, what are the biggest concerns about it as an intervention? How certain am I in each of these concerns? How much does this concern affect the bottom line impact of the intervention? And then talking to a bunch of different people and getting their input into it. And so what ended up happening for postpartum was saying, I have a bunch of different uncertainties. And I think it's important to remember as a baseline that you are going to be uncertain on every decision to some extent. And you have to say, what's the level of uncertainty that I'm comfortable with? But I have these uncertainties. But the fact that I have so many uncertainties that like are of sufficient size and affect the bottom line so much that that's just like greater than the amount of uncertainties that I'm comfortable with, or comparing it to comparable options. And so I think that if you can be as clear as possible in articulating what you believe and creating opportunities for yourself where you can maybe test the truth, the ground level truth of that assumption, is really important. And I think that's extra tough when you're working in really speculative areas. So maybe you're thinking about something that's far off in the future or that's really speculative. But I think if you can at least concretely articulate, like, this is exactly how speculative it is, that makes a big difference in how well you can think about it.
Yeah. A kind of related idea that's helped me is assessing how speculative a project is and estimating the chances of success or failure. If the project seems worth doing, given those odds, I give it my best shot and aim to think of it as a good and worthwhile bet, even if it doesn't work out. Then I set a time frame, could be 3 months, to gather more information and kind of test things out. And if I reach a point where things look promising, I continue at that kind of 3-month mark. And that would be a success. But if not, and I kind of decide to stop doing the project because it wasn't as successful a test as I was hoping, then that is also a success. So kind of thinking of it as, regardless of the outcome, I've followed my plan and made good choices with the information I have.
Right. I am the world's biggest advocate of reevaluation points. I think that everyone should have reevaluation points, both personally and organizationally, where you're going to sit down and you're going to say, okay, we have this strategy. Our whole approach rests on these assumptions. Actually, A, should we have these assumptions in the first place? And B, how well are we actually doing in achieving this thing? Maybe there's different approaches to achieving our goal in a better way that's more effective. And I think that the genius of reevaluation points is that it both ensures that you have a time when you're going to be reflecting on your approach, and it also gives you permission to set aside your concerns on a day-to-day basis. Yes. So you write down that concern in your reevaluation doc, and then you go back to regular life, and you know that you're going to have a moment when you can come back and say, wait a minute, is this actually a good idea? And I think that it's really easy for organizations to not do this. So someone from a very large charity came up to me after a talk I gave on this topic and said, yeah, we totally don't do this at all. And I was really surprised because I guess I just kind of figured that everyone did this. But the fact of the matter is, I think that this kind of big picture strategic thinking just isn't often incentivized. And so you're maybe like, if your funder isn't going to pay for you to spend some time doing this thing, I mean, that's where you get all your money. So you're not going to spend time doing this thing. So I think it's really important as individuals and as organizations to be intentional about this, having this kind of reevaluation point. Because if it turns out that you were doing a suboptimal thing all along, like, that's a big problem.
Are there any other lessons you're taking from all this?
Yeah, I mean, I think that one aspect we haven't talked about much is this question of why aren't charities doing more of this thinking and this kind of reflection? And I think it gets at what I was just saying about they often don't have the money or the staff time or the resources to do this kind of reflection. And I think that everyone involved needs to acknowledge that if we're going to take evaluating our programs more seriously, if we're going to take monitoring our programs more seriously, that will cost money, and that we're going to have to incorporate this into how we fund programs, how we think about programs. Because if it's not getting prioritized, and when I say getting prioritized, I mean getting money, then it is not going to happen.
That makes sense.
I think one thing I'd love to briefly talk about is PlayPumps, because it's such an EA bugbear, but also I think really perfectly encapsulates a lot of what we've been talking about. So for people who aren't familiar, PlayPumps is this charity where they had this really exciting idea, which was you need to draw water from wells in many low and middle income countries. And often this involves a lot of laborious pumping that women especially have to do. And so they designed this play structure where the idea was kids play on the play structure and that like automatically pumps the water. And this was a really exciting idea. It just has this kind of intuitive appeal.
Mm-hmm. Super wholesome.
Yeah. It got huge amounts of money. And then it turned out, whoops, it actually like doesn't work very well. And then EAs love to hold this up as an example of, oh, look, like things in development often don't work. But I think when I started digging into this example, I was like, wow, this is even worse than I thought it was, because it wasn't just that this was something popular that was kind of like in magazine ads and people on the street started funding it. But like it got this big grant in 2000 and then like grew in momentum over the next couple of years. And you got to this point where like Laura Bush announced a $16 million USAID contribution to PlayPumps, and like big celebrities were doing these benefit concerts. And it was actually only once they had built like hundreds, over like maybe even over 1,000 of these PlayPumps, that some of these reports were commissioned or started seriously circulating, that actually went and like figured out how well it worked. And like it seemed from the reports that it was like pretty easy to figure out that it didn't work that well. And I don't know exactly what had happened in the process, but clearly before making these big donations, organizations, including orgs like USAID that require a ridiculous amount of reporting, were apparently not requiring reporting on the most important thing, which is like that this thing actually works. So when I started reading into this, it turns out that there's actually a bunch of different problems with play pumps. And just for context, like a play pump costs about 4 times as much as like a regular hand pump. And sometimes what they did is they replaced the regular pump with the play pump. And then like the play pumps were really complex, like they had a lot of parts. And so like when they broke down, it was tough to repair them. So not only are PlayPumps less effective, but I think you could argue that they were actually a net
negative
loss for communities, right? And so that I think is a really damning part of this. And I think it also goes to like the guy who founded PlayPumps, as far as I know, previously, I think had been an advertising salesman. And I think this speaks to what we were talking about the incentives, where like in order to make this program happen and to make this big change happen to the lives of these people in low and middle income countries, like in many communities, they weren't at all consulted. This thing just happened that made their lives worse because some salesman was able to sell something, not only to people on the street, but to some of the people making big decisions at the US's biggest development agency. And so to me, that speaks to the problems with current philanthropy. And I think trust-based philanthropy is in part responding to these problems. But I don't think it goes far enough in that, like, I think what charities have to do to be more accountable is to take more seriously this monitoring and evaluation, to, for any intervention that they're doing, actually do some sort of proof of concept test where they can go out in the field and consult with potential beneficiaries, see if it's really helping them. But you can't just ask them, is this helping you? Because, you know, they might feel pressured to say yes, but see, is it really connecting to aspects of their life where it's meaningfully improving them? So that doesn't mean giving textbooks written in a language that the kids can't read. That doesn't mean giving laptops to kids where there isn't electricity or where their reading isn't very good either. It means trying to focus on the interventions that are meaningfully improving people's lives, taking a serious look at like even some interventions that sound really good, even interventions that look good in initial randomized control trials don't always scale. So you have to have this consistent, skeptical perspective where you're running an organization and you're saying, we're so enthused to be running this organization and we trust that we all have great intentions here, but we also are going to be dedicating a meaningful part of our resources to checking up on, is this intervention a good idea? Is it still improving people's lives meaningfully?
Yeah. Okay. If you want to learn more about Sarah's lessons learned, I highly recommend the Asterisk article she co-authored with Ben, Why We Shut Down. It's so, so good. And there are also some juicy, some juicy quotes from people in the field who refused to even be named because they were so controversial. So it's just a really, really good read. Okay, let's move on. So you founded Maternal Health Initiative as a result of doing Charity Entrepreneurship's incubation program, which we've kind of pointed at a few times. But can you talk about the program a little bit more?
Yeah. So the program is really, really cool. I'm a big fan of it. I encourage people to check it out if you're interested. But basically how it works is Charity Entrepreneurship has a research team that researches what are some interventions that we think could be phenomenally cost effective, but there aren't currently a lot of organizations implementing it, or there's big gaps where it's not being implemented. And so they do this research. And then they recruit folks who are interested in starting charities. And they have a program where during the program, you do a lot of projects with other people who are interested in founding a charity. And throughout the program, you are both figuring out which of the ideas that they've researched you want to found. And you're trying to figure out which of the other potential founders you want to work with and maybe found a charity through. So throughout the program, you do these projects, you sort of do a provisional pairing. And then at the end of the program, you do a project proposal where you pitch for funding from their funding network.
Cool. And yeah, what exactly was the kind of process like of narrowing down your options and choosing like a specific intervention to found a charity around?
Yeah, I mean, the safe answer is always, it involved a lot of spreadsheets, but
spreadsheets.
It involved a lot of thinking on kind of from the highest theoretical level to the lowest practical level of these questions, like, how do I weigh different intervention effects? Maybe I only care about saving lives. Charity Entrepreneurship also does a lot of work in the animal space. So for some programs, though, I think ours was the rare all human interventions program. But for a lot of programs, people are thinking, hey, would I rather do a program that supports animals or that supports humans, which involves a lot of complicated philosophy and personal reflection, to also thinking about these more pragmatic considerations. So for me personally, my kind of top charity choices I was considering during the program were doing postpartum family planning, doing a charity related to road traffic safety, because deaths in traffic accidents are like one of the biggest causes of preventable deaths in the world. And there's been a bunch of charities that have found that like if you make policy changes in some countries related to speed limits or seatbelts, that you can save a lot of lives. And the other one I was considering was more of a research-focused intervention, doing research on different potential interventions that other organizations would then work on. And so for me, comparing these three different options involved a lot of questions. So for example, on a day-to-day basis, do I want to be advocating governments?
Right.
Do I want to be sitting at more spreadsheets? Do I want to be out in the field? So trying to think through those questions, try to think through what would I enjoy? What am I good at? A lot of really tough questions.
Yeah. Was it those personal fit considerations that pushed you toward postpartum family planning?
I think the biggest piece of it was the impact piece of it.
Okay.
Like I felt convinced that this was, and you know, kind of awkward to say this now, but I felt convinced that it was the most effective way to help the most people, which was really exciting to me. I think also as a feminist, I was really excited about an organization at the intersection of EA and feminism. But I was really excited about the other interventions. It's this funny thing where I'm bummed because when an intervention isn't started in a particular cohort, it gets moved to the next cohort. And usually it's eventually founded, but somehow still no one has founded the road traffic safety charity. So I'm thinking, oh, should we have founded it? Like, what would be going on with this charity right now? But yeah, it was a really interesting but tough process for sure.
Yeah, I mean, how do you feel about it now? My impression, and maybe we'll talk about this more in a minute, is that you didn't try to found something else. You've decided to do something different. But do you still recommend it to other people?
I absolutely recommend it. I didn't realize going into it how much I would learn, what a phenomenal network and community I would become a part of. I genuinely think that compared to my previous job where I was working in government and which I thought was a very decent first job after college sort of thing, I genuinely think that I learned 10 times more in this job than I did at my previous job. I would say it's like a big commitment, and I don't think you should underestimate how big of a commitment it is. But I think that it's a phenomenal program because for me, I not only learned about how to start a charity, but I learned a lot of great stuff about how to solve problems, how to approach difficult questions, how to navigate uncertainty that I think will be phenomenally useful with every other job and even beyond professional aspects of my life moving forward.
Wow. It sounds like it really isn't a normal job. It really sounds like it more than most jobs, including jobs, you know, where people work really hard, that it like really dominated your life. Is that kind of just the requirement? Is founding a charity just going to be probably that intense? And so people should go into it knowing that it's going to be really the biggest thing in their life for quite a long time?
So I'm wary of making sweeping conclusions on this because I am but one human. I think if I had to guess, I probably found it more intense and dominating than like the average person. And I don't want people to think that everyone has my exact experience with it. I will say, I think when I look at a lot of my friends and colleagues, I can see how this sense of personal responsibility takes a real mental and physical toll on a lot of people. And I think there's a real cost there. And I think even in a community that's as warm and positive as CE, I still think we could do better to say, hey, this is taking a really big toll on people. How can we do a better job of supporting folks? I think this is true in effective altruism more broadly, where people take these questions really seriously. They feel like what they're doing really matters. And so they put a ton of pressure on themselves. I know I've certainly put too much pressure on myself. But I would say, I think for many people, it's really big and dominating in their lives. I'm sure for some people, it's less big and dominating in their lives. I will tell you that there have been a number of people who are doing the program and running a charity, even though they have kids or even though they have substantial other obligations. So you don't have to like sign up and give up everything else in your life. And just for context, for example, like I tried to avoid working on weekends. You know, I would sometimes say, I can't do this work trip on this dates because I have family commitments. So absolutely, you don't have to kind of sign everything away, right? But I think you should take seriously that it is a serious commitment.
Yeah. Are there other kind of traits of a person that might make them a better fit for the incubation program?
Yeah. I mean, I think part of it is being hungry to meaningfully change the world, being bought into this evidence-based mindset. I think probably the biggest differential factor is this question of how comfortable are you in a fast-moving, uncertain context where you both have to take a lot of responsibility and you need to be self-motivated. So startups are their own beast, you know, and you have to be willing to wake up in the morning and you don't have a boss. Like it's up to you to make the decisions on what you work on that day. I think CE, one thing I remember reading is they say, if you're the kind of person who can take a self-directed online course and complete all the stuff despite having no one haranguing you, like that's a good indicator. Frankly, I think most people, myself included, tend to like underrate their ability to do this kind of thing. So at some point they did some sort of survey and they asked people who were charity founders through the program, like, did you think you'd get into the program? And most people were like, no, I didn't think that I'd get into the program. So I think if you're excited about this sort of thing and it sounds like it might be a good fit, then it's worth applying for and figuring out whether it's a good fit along the way. But I do think more people than realize it have this kind of entrepreneurial mindset.
Yeah. What was it obvious to you all along that you were the kind of entrepreneurial person who would thrive in a charity kind of incubation program like charity entrepreneurship?
Absolutely not. I don't think I had ever once thought that the word entrepreneurial applied to myself before I applied to CE. I think I'd always thought of entrepreneurship in terms of tech and business, like pitching your cool new app idea. And I don't think of myself as particularly techie or businessy. But what happened is I was just kind of aimlessly scrolling through the EA forum. I saw a post about charity entrepreneurship. They had this quiz you can take. It feels kind of silly to say, but they had this quiz you could take where you could say like, oh, what are these different personality traits that you have, things you've done with your past. And I am the kind of person who, when I was in high school, I like to like start a lot of clubs or run a lot of clubs or like do these projects on my own. And I think it wasn't for me that I looked at that title of like charity founder and I was like, oh, wow, that is absolutely me. But like I took this quiz and it was like, maybe you're a good fit for this. And as I started thinking about it, I was like, oh, yeah, maybe entrepreneurial is a decent description of myself. I do like things that are fast moving. So I think that's a pointer to like, it's not always that you first hear about an opportunity and you're like immediately like, this is my life's quest. I'm going to absolutely be this person. Like sometimes it's just helpful to investigate a little, keep an open mind, and you might realize that you're actually a really good fit for something that you'd never considered.
Any advice for someone considering founding a charity, given everything you've learned?
Yeah. I think that a program like Charity Entrepreneurship helps a lot in helping you get these networks, helping you get this support. But I think if you're the kind of person who wants to found something and has that drive to found something and feels like you can do it outside of that network, that absolutely also is phenomenal. More organizations is great, assuming that they have perspectives where it's going to be a net positive. I think if you're doing the program specifically, it's really helpful to have an open mind about other founders and interventions, while also realizing that this is a person that you're going to have to be working with for years, potentially, that this is an intervention that you're going to be owning for years, potentially. I think early on in the program, I felt nervous about like asking questions that might sound dumb to people who'd written the research reports, or talking about things that might make me sound dumb to other potential co-founders. But this is a big thing and it's a quick research process. And as we've learned, sometimes they miss important aspects of the intervention. So you can come in and take yourself seriously and ask really critical questions about, is this intervention actually a good idea? Because I do think that, some of the interventions that CE recommends are incredibly phenomenally cost effective and blow other even top charities out of the water. And then I think some of them are less exciting and less promising. So if you go in and you have strong feelings like of this intervention looks a lot better, like you might be right. Trust yourself. And then when it comes to your co-founder, I think I initially was very focused on these questions of professional compatibility. So with my co-founder and I was like, well, we're both we have similar strengths. We're like both generalists. We're like communication, research-y kind of people. Maybe we're just not a good fit. But we realized that mattered less. And these questions of how well do you work with this person? Can you handle conflict well? And I'd say most importantly, is this a person you can trust? So I think when you're imagining, and this extends to not just starting a charity, but like doing a close professional or otherwise collaboration with someone, you have to ask yourself this question of, if I imagine the two of us in this difficult scenario where we have to make a really tough call, do I trust this person to be on my team? Do I trust that we can work together in both the moments when things are going really well and the moments when everything seems like it's falling apart? And I think there's a lot of fancy ways you can think about compatibility, but that is the most important question at the end of the day. And I feel so lucky to have worked with Ben. He's just like such a phenomenally competent person, such a phenomenally smart person, but also just someone who I really, really trust and made it not only like doable, but fun and exciting to run this sort of charity with. So I encourage you to think seriously about the kind of person that you work with.
Nice. Okay. So yeah, you went through this whole experience and then you entered the job search. And as many job searches are, it sounds like it was probably had some ups and downs. But you now know what you're doing next. What are you doing next?
So I recently joined GiveWell on their malaria team. And I am super excited about this because I've been a big fan of GiveWell for a long time, and I think it's a good fit. But it's been really cool to join the team, and I'm really excited about what the next couple of years are going to bring.
That's so exciting! Congratulations!
Thank you.
Okay, we've got time for one more question. What is one of the most valuable mistakes you've ever made, and how can our listeners learn from it?
So I'm not going to say starting MHI if that's what you were digging for. So I think for me, I look back on my career, such as it is, and I think back to when I was 17, I first learned about EA, and I read about it on the internet. A friend introduced me, and I just thought, this seems just true. Like, this seems like a great way of thinking about the world. I want to be an EA. How can I become maximally part of the movement? And I feel weird saying this on the 80K podcast. Maybe I'm not allowed to say this, but I went on the 80K website and I said, oh, hey, what should I do? And I was reading through all these opportunities, and I had this sense of, oh, you need to be like a really exceptional person to do these really important things.
Yeah.
And I was like, well, I mean, statistically, it's unlikely that I'm that kind of person. I don't feel like I'm that kind of person. And I think maybe there was also this element of like maybe some of the specific things that were described. I was like, oh, I don't look at any of these and think like, oh, I should definitely do this thing. So I kind of just left it there. Like I went through college. I was like, I'm going to be a vegetarian. I'm going to donate my money to these effective charities. But like maybe the career stuff isn't really going to work out for me. And then like after I graduated college, I applied to a bunch of EA orgs, like not that many in retrospect, but what felt like a lot to me. I was rejected from all of them. I said, okay, this isn't going to work out. I'll just like work in government or whatever. And eventually I learned about CE and I went through the program. But there have been so many moments when I kind of counted myself out and where I said, I don't think I'm good enough to do useful things in the world. And I think the fact that I've been able to do things that are hopefully useful for the world shows that I was wrong. And then I think also kind of being on the inside, having friends who run orgs and they'll say like, we're hiring and we just like can't find the right person for this job that is like really useful for making this organization run. Like, I think I could probably think of like 5 different things like this right now. And like those jobs, it's not always like the really exciting, jazzy thing like running the org. Like I don't want to overemphasize the like everyone should go found an org, because I think org founders and people who run orgs get too much of the credit and too much of the social status, right? But like practically, like the org works because it has all the different parts, right? And all the different parts is like the person who makes sure that the website works and like the person who processes the donations. And also I think that there's so many phenomenally impactful opportunities that are outside of the direct EA sphere. So I think that like, I don't think that if you want to help the world, you need to say like, I need to fit into this exact mold, or like, I need to be exactly like who someone else says I need to be. I think that like, there's so many different ways that you can help, like whether that means working at a job where you make a lot of money and like donating a lot of that money, whether that means like working in some government position where there's like a lot of leverage and there really are lives at stake, and being the person in the room who says like, hey, maybe we should use more data to inform this decision. Or maybe it means like working at a super impactful organization and help making it be even more impactful. I think like I've made the mistake of counting myself out too early and of thinking I had to be one exact thing. And I think I just really encourage people to trust themselves and to know that you'll get rejected from a lot of things. Like, I mean, it was like 2 months ago and I was sitting there feeling not great because I kept getting rejected from things. And then I ended up getting the job offer that I was like most thrilled about, and it's like the job that I most wanted, right? So like sometimes you just got to give it a little time.
Yeah. I do feel like it is this brutal ask that I think at 80,000 hours we make a lot. It's like, be brave and try not to let yourself rule yourself out of opportunities because you think you might not be good enough and because the rejection would be really painful. And it's true that it would be really painful. And it's true that if you're applying to the right number of jobs, you will get rejected much, much more often than you get job offers. And I hate that we ask people to do this because you've been through it and I've been through it and it sucks. But yeah, I think it is the approach that for many people is like important if you can stand it for trying to figure out how to do the most good with your career.
Right. Absolutely.
Well, thank you for that. And thank you for continuing to, apply for jobs despite it being demoralizing and rough. And congratulations again.
Thank you.
We are lucky to have you. That is all the time we have. My guest today has been Sarah Eustis-Guthrie. Thank you so much for coming on. It's been such a pleasure.
Thanks for having me. This has been surprisingly fun.
Nice. I'm so glad to hear. All right. The 80,000 Hours podcast is produced by Kieran Harris. Content editing by me, Katie Moore, and Kieran Harris. Audio engineering by Ben Cordell, Mila McGuire, Simon Mansour, and Dominic Armstrong. Full transcripts and an extensive collection of links to learn more are available on our site and put together, as always, by Katie Moore. Thanks for joining. Talk to you again soon.